patient asks you what confidentiality or what, for example, if any patient in PLAB 2 asks you, what is this? Now you will have to explain it in details because you have to emphasize in it to show the patient the importance of this thing. Okay? Okay. Dr. Nigar, don't worry, it has just started right now. We revise, we have a quick recap about this presentation after we are done with it. So, again, confidentiality will explain the confidentiality, and the patient will or the mother will ask you one simple question. She is 15 years old. How dare you prescribe the pills to someone who's 15 years old? This means that the mother is, I'm sorry to tell you, but she's underestimating her little one. She's underestimating her mental capacity. So you will simply tell her that we usually assess the mental capacity of our patient before prescribing these things. What do you mean, doctor? Now you'll explain the mental capacity. We check her ability to understand, her ability to retain information, and her ability to understand the implications of the information, and her ability to make decisions. So simply, you'll explain the concept of mental capacity to her. What is the meaning of mental capacity? Number one, ability to understand. Number two, ability to understand the information given. Number two, ability to retain the information given. And number three, ability to make decision. And number four, ability to understand the implications of the decision. Definitely, after that, she'll ask you one question, doctor, but how can you prescribe the pills for someone? Oh, sorry, she'll ask you this question, doctor, is it legal for someone under 16 years old to practice sex in UK? The legal age of sex in UK is 16 years old. However, they will more likely continue the sexual activity with or without being legal. And here comes our turn to warn them about the implications like unplanned pregnancy and STI and advise them about safe sex. So they will likely continue, and here comes our turn to prevent this or to prevent the implications. One more challenging question. What if she's involved in a relationship with her teacher or with someone who is much older than her? You will simply tell her that this is one aspect we explore. Usually we explore the age of the partner and if he's in a position of trust or not, and if she's involved in any abusive relationship under alcohol or sexual harassment or not. And if this ever fulfills, we will definitely breach her confidentiality or breach the confidentiality and inform number one, the family, number two, the police, number three, social services. So the cases in which you breach confidentiality are what we mentioned. What if she was your daughter? Would you tell me the same? You do not understand how worried I am. When someone is trying to reflect or to play it smart against you by reflecting the whole matter against you, you don't have any other option but to validate. I can see that it must be real frustrating, but I'm afraid we are not in a position to disclose such information to you. So you validate and you still insist on your case or insist on your reason. Say, I can understand how it can be frustrating for you, but we are not in a position to disclose it for you. If anyone reflects something personal against you, always validate. Validate and play on their feelings. Rather than do not mention anything personal about yourself. Don't say, for example, yes, you are right. If she, but this condition is, or this conversation is not about me, it's about your daughter. Don't say this. Okay? Some of them may consider it like upsetting. Just validate and say you are not in a position. Like with a head nod your head a little bit and say you are not in a position to do that. I'm sorry. In the end, she will ask you, doctor, we are strong Catholic family. You don't understand our conditions. Really, we are strong Catholic. I'm a bad mother. I could not raise my daughter. Now you will show sympathy and empathy to her, and you will tell her that I do respect your religious belief, and I'm sure that you are a good mother and caring mother even to her, and you know her better than anyone. I'm sure about that. But why don't you try talking to her in another time, like for example, in different time and setting, and definitely she will open up to you. This is the station so far. You will be left with 1 minute or half a minute more You can tell her, for example, why don't you befriend her? Like befriend her. Like for example, try to enjoy or try to involve her in your activities. Try to share with her your stories from the past or any stories in your life. Maybe she will be more close to you and open up to you about everything in the future. Yes, you're true, you're true. Sometimes she can be upset and she can ask you, I need to talk to your senior. I'm sure he'll provide me with information. You don't know anything. So you can say that definitely I can arrange for your meeting with my senior. However, I'm afraid that all medical professionals are bound to the same ethical rule. Mental capacity is very essential in this education diplomacy to mention. I told you the core is number one confidentiality, number two mental capacity. So again, if someone asks you about the senior, you will say that definitely I can arrange a meeting for you. However, I'm afraid that as medical professionals, we cannot disclose. We are all bound to the same ethical rules. Okay, same ethical rules. This station is challenging, but if you say that if you stress on these two things, confidentiality and mental capacity, you will definitely pass it. And if you want to score high in it, you'll be very calm. Very calm. Any angry patient, guys, the patient is not going to eat you. You just need to be honest and you just need to be calm. This is what I'm asking you to pass any ethical patient, especially the angry patient, which I really enjoy. Okay, let's move to one more station, which is close to it. The morning after pill. I got this station in my exam and I got 12 minutes without even finishing it. Why? Because my main concern was to assure the girl and to stress on the fact that we are going to help her and support her and provide her the best thing. So please don't worry. What did I do? And what you should do? This girl or the task says that you're FY2 working in GP and there is 14 years old female patient, okay? 14 years old female patient presented to the GP clinic because she has got some concern. Why some concern? You will know when you enter. Sometimes there can be a twist, and the task says that she has got some personal issue. Okay. By the way, this station changed recently. Not a change, like it has come with a twist in which she does not need emergency call. She needs as well long-term contraception, like long-term pills. So it will be number one. This station, please mark, it is assessment of mental capacity. It is assessment of mental capacity. Why? 14 years old girl who wants oral contraceptive pills. Definitely, you have to assess her mental capacity. And how to assess the mental capacity? You have to check her understanding about what she is asking, the oral contraceptive pills, if she knows about them or not. Number two, you have to check her her ability to recognize here. Part of the mental capacity is to check her idea about the STIs as well, if she knows about the STIs or not. Okay. Number three as well, you will check her ability of understanding the implications of unprotected sex. Those are the three things. Number one, her ability of understanding her idea about the pills. Number two, the understanding of the STIs. Number three, very important, the implications of unprotected sex. Okay, this station is quite similar in terms of talk, but in a reversed manner to the previous station, which is the concerned mother. Okay, okay. So in this station, in this station, you will find a 14 years old poor girl. She's sitting on the chair, giving you poor eye contact sometimes, and she wants you to give her the pills. She will tell you, doctor, I need the pills. May I know why you need the pills? First, definitely reassure her, and we are all here to help you. Yes, definitely. I will tell you right now everything, Dr. Safa, in bad details right now, like in full details. And by the way, she will never let you. She will never accept it from you. Okay? So do not worry if she does not accept such things from you, please. Okay, let's proceed. Doctor, I need the pills. Definitely, I'm here to help you and address all your concerns. May I know which pills? Because some people may assume that she needs. You don't know that she needs oral contraceptive pill. Always ask, may I know which pills? She will tell you, Doctor, oral contraceptive pills. May I know why? Because, Doctor, I had unprotected sex last night with my boyfriend. And may I know why you need the pills? Doctor, because I don't want to be pregnant. Have you done any pregnancy test? So when someone wants just do not want to be pregnant, always ask her about the pregnancy test. She will tell you, no, doctor. Okay, that's fine. Doctor, will you give me the pills? I just need you to ask you a few questions to be in a better position to give you the pills. And if everything goes smooth or if everything is okay, I will definitely prescribe the pills for you. Okay, doctor, ask me, I'll be quick. Okay, I'm going to ask you. First of all, here we need to take some medical history to rule out the contraindications of the pill. Like what? You'll ask here, do you have any fever or flu-like illness recently? Sorry, do you have any fever or vomiting or diarrhea recently? No. Why? Because vomiting and diarrhea will make her not benefit from the pill. The pill will be lost in the vomitus or the diarrhea. Number two, do you have any medical condition? While asking about the medical conditions, it's a very good idea to ask here, have you ever heard about something called STIs, sexual transmitted infection? Because this is part of the mental capacity. She will tell you, yes, doctor, I read about it in the school magazine. Well, that's good. What did you read? I read that it's transmitted basically through unprotected sex. Well, that's right. That's right. I'm glad that you read about it. Okay, now ask her, does she take any other medications and family history, like some family history of any medical condition? Does she have any allergy? Move to the lifestyle. Do you smoke? Speak about the period, very important. After the lifestyle, always speak about the period here in this station. Why? Because the period are actually, this is morning pill. It can be related to the period, or this station is about mental capacity and the period as well. So how is your period? Is it regular? Do you have any heavy flow? No. Have you used any form of contraceptive before? You know the four piece now. Have you used any, or do you use any form of contraceptive? Yes, doctor, we use condoms. And why didn't you use it? Doctor, because just we wanted to enjoy. Okay, that's fine. Um, no need to ask her about pregnancy because she's worried about pregnancy. So she has never been pregnant before. Now, listen, we explored her medical history. Let's explore her social history. Remember from the past station? From the past station, we explored her social history and the family conditions, okay, beside her mental capacity. So, in the social history, you will explore the famish. You remember the famish from psychiatry? They are typically the same. Why? Because actually you need to explore how has this relationship affected her. She's still 14 years old. So maybe she has got some depression out of the relationship or some anxiety out of this relationship. So number one, medical questions. Number two, psychiatric questions. Especially because she's an underage girl who's in a relationship. Okay? Now you'll ask about the family, whom do you live with? How is your relationship with them? And have you informed them about that or not? No, I didn't inform them and I would not tell them about this. Are you going to tell them? Every time she asks you this question, please be calm and tell her we cannot tell her. We cannot tell them unless you give us the consent. Okay, better. Ask about the friends as well. Does she have any friends? Meanwhile, elaborate the boyfriend. For example, the age of the boyfriend and how did they meet and how is their relationship to ensure that she is safe and her boyfriend is not in a position of trust or much older than her. Now you can elaborate her study Is she coping well with the study? To see how has this relationship affected her performance in the school. Okay? Okay. Ask one question about the mood as well to check her mood. Now, move to the disclosure. You're going to examine her and examine her tummy as well before prescribing the pills, and you may need to do pregnancy tests. We're going also to do pregnancy tests. The examiner will tell you, proceed, doctor. Okay, doctor, are you going to give me the pills? Yes, from what you told me, it seems that you are fit to take the pills. However, let me ask you first. Do you know how the pills work? Actually, this question, you can ask it in the beginning. After assessing her idea, may I know which pills you need, or may I know which pills you are speaking about, and why do you need them? And do you know how do they work? You can ask it, but it's better to ask it in the management after disclosing that she is fit to take the pill. So number one, you will assess her medical history, including her understanding about the unprotected sex in this age. Number two, you will assess her social or her collateral history. And number three, you will give her the pill. Tell her that the pills work by preventing the ovulation, the ovulation, which is the release of the eggs from the ovary. Doctor, do they have side effects? This was his only concern. Do they have side effects? They may have side effects. Like, for example, sometimes it can cause some irregularities in the period, and it can cause some tummy upset. So if you experience any vomiting within a few hours or within especially the first 24 hours after taking the pills, please come back to us because this means that you may need another pill. Okay, doctor. Meanwhile, don't you think that informing your parents is a good option in this time? No, I do not want. Why you want me so? Because actually, having sex at this age sometimes can have some physical and psychological implications on you. No, doctor, I don't. Thank you for that. Okay, I'm just encouraging you, and we are not going to tell them unless you give us the consent as well. Okay, better, doctor. Now you have time. You can also tell her about some other things. For example, you would tell her that we consider the pregnancy test for you, number one. Number two, also, you will tell her that there are other long-term contraceptions. If you want us to discuss them, we can arrange a separate session for you. Okay, no, doctor, I was just interested in the oral contraceptive pills today. Thank you. Now you can tell her, I'm going to give you the pill. The examiner will tell you as you. Because actually you have to verbalize that you need to give her the pill because she was fit and everything was right. So now you are going, okay, I'm going to give you the pills right now with a glass of water. One important thing, guys, to sum up this station because it's confusing. Number one, you will start with taking some medical history, including the STIs, her understanding about the STIs. Number two, you will ask about, of course, the medical history is including the 4Ps. Okay. Number two, you will explore the collateral history, including social history like the family, the friends, the famish, and the friends are including the boyfriend. Number three, you will give her the pills and explain how the pills work to her. Number four, you will warn about side effects. Number five, encourage family or encourage to involve family. Number six, as well, other long-term contraceptions, which she is not interested in. This is the station so far, and it's very. By the way, you can get easily good score in this station, but she is very. I mean, sometimes she's giving poor eye contact. So please try to always tell her. I can see that something is there anything bothering you. I can see that you are quite worried. So always verbalize this. She will tell you, doctor, are you going to tell my parents? When you tell her this, please don't worry. We cannot tell anyone unless you give us the consent. Always repeat this. Don't get bored because she's really bored. She's really ashamed of what she has done. Okay. Next station, we will practice the next station as well. What is the next station? Um, okay, right now we will practice the missed the blood sample. This is sort of angry patient. Okay. In this station, simply, I need someone to volunteer to practice it with me. Okay. And I will just give 1 or 2 tips before starting it. And who wants to practice? Dr. Mahdi?
Yes, I am.
Okay. In this case, you will need to open your camera.
Okay, just give me a moment.
Yep. Okay. Wait. Give me. Wait, Dr. Mahdi. Wait, sir. Wait. Yeah, it is a telephone call.
Hello?
Dr. Zaid. Yeah, hello, Dr. Mahdi. Wait, I will open my camera right now.
Yes, how are you?
I'm fine.
Okay.
Dr. Mahdi, before starting, let me give you the task. You're FY2, working in surgery department. The patient has come yesterday because he was having he was scheduled to have a surgery, hip replacement surgery. So he came yesterday to take the blood sample. You took the blood sample from him, and they got lost. You forgot to label them, and you lost it. The day was very busy, and that's why you forgot to label it. Now talk to the patient on phone call. Disclose. Now talk to the patient on phone call. Disclose about what happened. Okay, and address his concern. Special note: none. Dr. Mahdi, before starting the station, what is the importance of the blood sample?
To know about the patient status, whether he is fit for surgery or not, is the most
How?
important thing.
How?
Because we need to check for his blood, his urine, his chest X-ray. We need to check for his kidney, his lungs,
Perfect.
heart is all right.
Perfect. Perfect. So this is what I need from you. Okay? This is what is
Yes.
important because you will justify yourself using this. When I ask you how could this happen, doctor, what will you say?
From what I know, actually last day I was very busy.
Wrong. I told you that you should not focus more on giving excuses. You should always apologize first.
Okay.
And
It's
then
my fault.
Yes. Yeah, apologize first and then give excuses. Okay, Dr. Mahdi? Okay.
What's the name of the patient?
The name of the patient. Oh, by the way, you are not supposed to open the video. I'm sorry. You can close the video because this is a phone call. This is a phone call.
Yes.
Okay.
Thank you very much.
Okay. Don't worry. We'll be picked up later to practice on
fine.
video. Okay. The name of the
Okay,
patient. Okay. I will provide you with the information. The name of the patient is Mr. Robert Matson, and his date of birth is 15th of January 1962. And by the way, you will find the information written in the task beside the phone.
Okay. Let's start?
Okay, let's start. You want me to set the timer first? Wait. I'm setting the timer for you, and it is a phone call, Dr. Mahdi. Okay. How to elaborate or how to enter a phone call, Dr. Mahdi?
Okay, I will pick up the phone and I will tell, am I talking with Mr. Robert? May I confirm your age, please?
No. You will confirm the name. If I'm talking to Mr. Robert, and after that, date of birth and address. Date of birth and address, okay?
Address.
This is we said this in the first session. Wake up.
Okay.
Okay. Okay, let's start.
Hello, examiner. This is my GMC number.
Proceed.
Okay. Thank you. Hello.
Hello.
Hello. Am I talking with Mr. Robert?
Yes. I believe that you are from the hospital, right?
Yes. Yes.
Oh.
This is Dr. Mehdi Hassan, one of the junior doctor in this department.
Oh yes, nice to meet you, doctor. How are you today, doctor?
Yes, I'm fine. How are you now?
I'm fine too.
Okay. May I confirm your date of birth, please?
Yes, doctor, my date of birth is 15th of January 1962.
That's all right. May I know your address, please?
Doctor, I'm living in XXXXL. It's written in the task.
Okay. Okay. That's all right.
Mm.
Okay. Mr. Robert, uh, if you uh, if you know that okay, you must know that you had a blood test. Uh,
Yeah,
what I collected.
yes, you
Okay.
took some blood sample from me yesterday, actually. You told me that
Yes.
I'm going to receive the results today. So I'm really excited to know about it. It's more
Uh,
stressing to me more than today's match.
okay. But before that, may I ask you a few questions?
Yeah, sure, ask me.
Okay. Thank you very much. Uh, Let me know what about your condition right now?
Uh, Doctor, actually, this leg pain that I used to have is not settled yet.
Hmm.
I just hope that it will be settled right after the operation.
Yes. Hopefully, you will be all right after the operation.
Yeah, I
I'm
hope
hoping
so.
for that. But at the same time, didn't you prescribe you any painkiller?
Yes, doctor, I'm taking painkillers, but they do not help me anymore.
Okay. For that reason, actually, your operation is pending. We are going to make do a surgery for you, but at the same time, for the betterment of for the to know that whether you are fit for surgery, we did some test, and we are expecting the result will come today. However, to be very honest, I missed your blood sample.
You what? What did you do?
uh, Actually, it was my fault. Please accept my apology. Uh, when after collecting your blood sample, uh, I should have leveled your blood sample and then sent to laboratory. But this time, I totally forgot to level this, and that's why the result hasn't published yet.
Oh my God. Are you
Actually, I'm
serious?
very sorry. Um, Actually, this is true, but actually, this is totally my fault. Please. I acknowledge my fault. Please accept my apology.
I can't even imagine how could this happen. If you're going to lose the samples, why you take them from us? You're such incompatible people.
Yes, you must be very angry, and this is totally your right because this is totally my mistake. But could you please pardon me for that?
What should I do right now?
Uh, uh, okay, right now, could you please come to the hospital again? And
Oh
I
no, I will never come to the hospital again. You want to take another blood sample from me? I'm having needle phobia and I just barely took this.
Uh, yes, I can understand this your situation very well, and you must have the right to say like this. But at this moment, your health is our first issue, because to improve your condition, we need to operate you and to check for your body is fit for surgery.
I
We
do
need to
not
do that
want
test.
to undergo this sample again. I'm having phobia of the needles.
Okay, let me reassure you, it will be a very sharp scratch, and you would numb the area before start the procedure, and you will be you will be under very least pain, and it will be very quick as quick as we possible.
Is it really my fault that you could not take the sample? Is it really my fault that you
Uh,
could not label it? You know what?
mm,
It's too time consuming and it's too long way to come from here to the hospital. And actually, I would pay too much. I paid at least to the cab at least 50 pounds back and forth. Is it really fair?
uh, Actually, this is totally my fault, and this is all of this done for me. I acknowledge this, but for you, it is not fair. It's not fair at all. But please pardon me because last day I was busy with a lot of patients, I did a lot. I collected a lot of blood samples, but this should not be happened at all. Uh, I should collect your sample. I should label your sample properly. But please come to
Oh
the
my God.
hospital.
I will not come to the hospital. I paid too much. Seriously, this is too much. Okay, take them tomorrow. Not take them today. I don't mind taking them tomorrow, but please not today. I paid too much.
I can understand from where you come from. I can understand from where you come from. However, if we take the blood sample tomorrow, I'm afraid that the result will not come out tomorrow, and we can't proceed to surgery because your
Why is
surgery
important?
is okay. Uh, this is important to check because we will give you some medication through your blood vessels before the surgery to make you general anesthesia. And for that, we need to check your lungs is all right, your kidney, liver is all right, and your heart is all right, and your blood is not weak. For that reason, we have to check for you, your body at first.
I really wonder. What can you do for me?
Hello.
What can you do for me?
Yes, if you come to the surgery, if you come to our GP again, then GP surgery again, then I would collect your blood. I'm just begging to you, please come to the hospital, come to the GP surgery today, and I will collect the blood as quick as possible. And I'm telling you that we won't be wait in a queue for a long time. I will take you to the collection room, and I will discharge you very shortly.
And will you lose it again?
uh, this time I will very much careful about labeling the sample, and I will take the sample to the laboratory by myself. I'm promising you.
Does it happen a lot in your hospital? See? I really wonder.
uh, mm, uh, but yeah, this is not happening, this is not the case all the time, but however, in some situation like this, when any medical error occurring in our hospital, we will inform our authority by filling up a form which is called incident form.
Move on to the next. What is this, doctor? Proceed, proceed.
Okay, incident form is a medical record by any medical error done by the medical personnel like doctors, nurse, that we need to inform our hospital authority by filling up this form, and by this way we will try to check our errors as low as possible.
Okay, thank you.
Thank you. Are you coming?
Let me think about it.
Okay, it would be nice if
It's
you come.
fine, it's fine. Your
Thank you
time is
very
over.
much. Thank you.
Okay. So, Dr. Mahdi, your history was very concise. You did not. You should at least take a little bit more history. You know, your history here took maybe 2 minutes. You should take one more minute of history. Like, for example, do you have any other medical condition? Do you take any medications? Like this. Some questions, like 1 more minute, because you need to gain marks in data gathering. You only asked about the hip pain. That's it. The so you in here you should start the station by asking them, may I know what did you use this blood test for surgery for my hip, doctor? And how is your hip right now? Do you have any pain? Do you have any problem with walking? Do you have any other symptoms? Let's speak about your general health. Do you have any medical condition? How was your health recently? Do you have any medical condition? And do you take any medications? Like a little bit of history, a plain history, but you still have to take it.
Okay.
But I found that suddenly you disclosed a medical error. Subhanallah. You were speaking suddenly, and all of a sudden, okay, so are you free right now? You don't have anything. Actually, I'm afraid that I lost your blood sample. Wow, interesting. Don't do this, okay? You know, you are going to have a tough time right now. So, do you have any idea why I'm calling you today, or what I'm going to talk about? They will tell you, doctor, I think you are going to speak about my test results. Actually, I'm afraid that I don't have something good to tell you, or I'm not having good news to tell you. Doctor, is there anything wrong with my results? You would tell him, I'm afraid that I forgot. I'm afraid that your result was lost. What?
Okay.
See how I brought it's not a breaking bad news, definitely, but you know, you have to be a little bit smooth while telling him about this. So now we
Okay.
disclosed it that you were doing, you forgot to label. Now you will tell him, you will keep apologizing like you did, and say that in the end that, I mean, for example, you'll say that I'm really sorry this shouldn't have happened. Please accept my apologies. I'm afraid that the day yesterday was quite busy and we were having too many samples to do. That's why I forgot to label. Having said that, this is not an excuse. It will be repeated right now, Dr. Maria. I will sum it up. Having said that, this is not an excuse. And then he will keep like scolding you. When he scolds you, always keep apologizing. Keep apologizing all the time when he scolds you. Then what can be done right now? You said everything right. You said we need to take another sample from you. For example, he is needle phobic. You will offer him that. It will be sharp scratch and will be as quick as gentle as possible, and we will numb the area.
Yes, I told.
Okay? Dr. Lamia, we do not give sleeping medication for a blood sample. You just numb the area. It's simple blood sample. It's just, like few seconds procedure, like 10 or 20 seconds. Okay, after that, you did not answer my question. I know why you did not answer it, because it's not in the script, right? The question was that, Doctor, I live far away. I paid £50.
Yes, yes.
By
Okay,
the way,
yes.
you
It's not.
can, yeah, you can offer him a cab. There is a car cab, there is a hostel cab for transport, yes,
Oh,
that you can offer to these people, but not an ambulance. Do not offer ambulance. This is not an emergency. This is a like elective procedure, so you can offer a hostel cab, okay,
okay.
to bring him back and forth. What is the importance of the blood sample? You said it good, liver and kidney function test, and you forgot to mention about the blood grouping and the cross-matching. Very important to mention about them.
Okay.
Okay,
Mm.
Dr. Mahdi, also one important thing. When I ask you, I told you many times, guys, when someone asks you one question, for example, he tells you, I do not want to come, I do not want to be admitted, I do not want. When some person is having any concern, always ask me, I know why.
Um,
Yes.
Actually, you told
No,
me
no,
that.
no, wait. I told you, doctor, I do not want to come back again. I paid £50. So I gave
Yes.
you the reason, but you addressed it in a very wrong way. Okay, you spoke about something else. You spoke about the importance. So you are telling him like, screw your money. I just need to take the sample right now. No, tell him that we can offer you solution regarding your money actually, because you paid £50. So we can anyone to pick you up, we can offer you a hostel cab to bring you. Yes, Dr. Islam, you can arrange, not it's called hostel cab. They use it like a hostel cab to bring him back and forth. Yeah, you will tell him yes, we can arrange transport for him. Um, okay, now you will explain to him the importance as you did of the blood sample. Why is it important, doctor? Because as what you said, liver and kidney function test, you forgot the blood grouping and cross matching. Okay, and then when he asks you, is it my mistake? Apologize again and again, but promise him you will see him the first one. I mean, whenever he reaches the hospital, you will definitely meet him right away and take a sample from him, and he will be a priority. You will not need to wait for long. You will just meet him right away. When I ask you, does it happen a lot in the hospital, Dr. Mahdi? You replied, okay, your reply was good, but you made a mistake. Usually, it doesn't happen all the time in our hospital. Okay, this may sound awkward, but grammatically, can be upsetting to any patient. This doesn't happen a lot in our hospital. No, just say that usually such things don't happen. Okay. However, to make sure that they do not repeat, we're going to fill an instant form. Would you like me to tell you about it? When you say any concept or any, like, how can I say, um, anything, like, any, for example, you say instant
Medical
form.
error.
Instant form, okay, let me tell you better. Instant form is a form which we fill and we escalate to the hospital authorities to improve or to help us improve our services provided to our patients and to avoid such instances. That's happened. That's very simple. And you said very right as well. In case of medical error, we do this, and we will escalate to our seniors as well. So in case of any medical error, number one, escalate to senior. Number two, instant form. If the patient insists on complaining, please offer pulse. If he has no time, okay, as soon as you reach the, okay, Dr. Islam, if he has no time to go to the hospital, okay, you now have to stress on the importance of the sample because this is the surgery which is set to be tomorrow. Okay, you have to stress on that, and by the way, he usually will accept that. Sometimes actually he will tell you, doctor, I'm having so many errands to do today. I'm going to be admitted in the hospital tomorrow. I don't have any time to come back to the hospital. Just ask him, may I know when will you be free? He will tell you, doctor, I may be free at maybe around 10 p.m. It's fine. You can come here and we can receive you anytime.
Okay.
So the idea here is that will be open. I mean, the lab will be open 24 hours. So he can come whenever he's free. Okay? But it's better to take it as soon as possible. Why? Because it needs to be issued before the operation tomorrow. The operation is usually in the afternoon tomorrow. So you need it 24 hours before the operation, or you at least maybe 12 hours before the operation at least. Okay? I hope this was clear.
Okay. In this case, you didn't tell me that you want to complain.
Yeah,
So
because you did not
I
have
shouldn't
time.
ask for.
No, 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 Dr.
Yeah.
Mehdi, we agreed before that you never offer pulse unless the patient
Yes.
insists on complaint. Do not put yourself in trouble for no reason.
Yes. Exactly.
Okay?
Yes.
So, was there anything unclear in this station?
Yes. In the last sentence, I told you, "Are you coming?" Is that all right?
I will think about it. You know why I said I will think about it? Because you did not offer me the cab.
Okay. Yes. Actually, I didn't know about this.
Okay, but that's why I threw it to you because I know that it's not in the script. But this question can be asked.
Okay. Thank you very much. Thank you very much.
Yes. You are welcome, Dr. Mahdi.
Okay.
Okay. So one more station quite similar to it, the myth sample of the post-infectious glomerulonephritis. More or less the same. It's quite similar to the previous station. But one important difference here to point out is that you have to take a little bit history here. Why? I will tell you why. The task here says that you are FY2 working in medicine department. The patient has come 2 days ago because he has been taken or he has been scheduled to take kidney biopsy. Okay, so he's taking kidney biopsy. Why? Because he was suspected or he was suspected to be having post-infectious glomerulonephritis. Post-infectious glomerulonephritis. Again, post-infectious glomerulonephritis. What is a post-infectious glomerulonephritis, guys? It's simply the infection of the glomeruli of the kidney, which are responsible for the filtration of the harmful and toxic substance throughout our kidney. Okay, so this guy has come because of the sample. What is the importance of the sample? The importance of the sample is to confirm the condition. Okay, okay. The sample was lost and no reason or no valid reason has been detected, and the hospital has been searching extensively to find a sample, but unfortunately the sample was not found. The lab has called you and they told you that they have never received the sample. So no reason for the loss or for the missing of the sample. Talk to the patient, disclose what happened to him, and address his concern. Now you will enter this station and you will find the patient sitting normally. You will ask him, how can I help you? He's here for his test results. The poor guy does not know that his sample was lost so far. So tell him, I'm here to help you and address all your concerns. May I know why did you do this test? He will give you some shortness of breath, some swelling in the legs, sometimes some hematuria. The three symptoms of PIGN, post-infectious glomerulonephritis. And how are you feeling right now? He will tell you, yes, I'm feeling a little bit better, doctor. And did you have any other symptom? Like what? Maybe nausea, vomiting? No. Take some history from him. Which history? Like, for example, past medical history. Have you had any similar episodes? How was your, this question is very important. How was your health recently? He was having flu-like symptoms recently. Usually PIGN comes after flu-like illness, 2 weeks. Do you have any other medical condition? Like what, doctor? Like high blood pressure or kidney problem? No. High blood pressure is important to ask here because high blood complication of high blood pressure are kidney problems. Okay. Um, One more thing, actually, you will take some lifestyle history from him because actually the management of the PIGN is lifestyle advice. Do you smoke? Do you drink alcohol? What about your diet? Do you include too much water or salts in it? Because he has to cut down the water and salts in the diet for the management of the PIGN, which you will say if you ever have time. Now move to disclosure. You will tell him, thank you. Do you have any idea? Do you have any idea what is PIGN? He will tell you what is this, doctor. Now you will explore his idea about the condition. Again, like any station. It is actually inflammation in the glomeruli, which are something in the kidney, responsible for the filtration of the toxic substance from the body. Why does this happen to me, doctor? After flu-like symptoms, the bug will travel and infect the glomeruli, cause inflammation and swelling, and the glomeruli will be affected. Okay, thank you, doctor. So what about my test results? Now we will tell him again. Actually, I don't have good news. Today the lab called me and they told me that they have never received your sample. What? What do you mean by that? I'm very sorry. Please accept my apologies. It means that your sample actually was missed. We searched the hospital extensively and we could not find any reason for it. Oh my god, I can't believe that. How could this happen? Again, accept my apology. This shouldn't have happened. Who took the sample? Actually, your colleague has taken the sample. So you would say that actually one of my colleagues took the sample. However, I will definitely talk to find out what happened and try to explain this to you later, or try to explain himself to you. Okay, sometimes he can ask you, doctor, go and talk to your colleague, and when you find out what happened, come back to me. If this ever happens to you in any station in PLAB 2, you would definitely say, I'm definitely going to speak to him after this consultation. But now my duty is to sort it out for you right now. We do not want you to stay like unhappy with us. So what happens right now? You would definitely tell him that okay, simply before starting or before offering the solution, he would ask you, doctor, why did it take 2 days to tell me about this? Are you still waiting 2 days? You will tell him that usually it takes the lab 2 days to examine the sample under microscope and then give us the feedback or the results on phone. So what are you going to do right now? Now you apologized. When number one, in angry patient, apologize. Number two, offer solutions. Apologize and offer solutions. So apology comes first before offering solutions, please. Now we need to take another sample. What? No way. When someone is insisting on something, we ask why. Doctor, it was very painful. We will make it as quick as possible and we can give you numbing agent and we can ultimately giving you mild sleeping medication. Why here I can say mild sleeping medication? Because this is biopsy, this is not simple blood sample. In biopsy, I can give mild sedative. But say sleeping medication, do not say sedative. Sedative is a medical jargon sometimes. Okay? Okay. Doctor, is it my mistake that you lost it? You're going to take another part of my kidney? I'm very sorry. Please accept our apologies or my apologies on behalf of me and my medical team. Is it really important to take the sample? You will tell him, actually, this sample is very important to confirm the diagnosis, as well to exclude other conditions. And that's how we will start your treatment in a better way and as soon as possible. What could be the treatment here, doctor? He will not ask you this question, but if he ever asks you, you can say some general advices, lifestyle advice, like number one, abstain from alcohol. Number two, smoking. Number three, cut water and salt in diet, and try to be a little bit physically active. And if he's ever having hypertension, it's better to bring it under control. So what are you going to do for now? We're going to take another sample from you. When will be that? Definitely we can put you as a priority. I'll definitely arrange a meeting for you with my senior to speak about the next sample or schedule the next sample. Because this is a sample. A sample will be done by senior. So we will let him talk to the senior to find out the sample. Okay? If he asks you, does it happen in your hostel? You will tell him instant form. And if he insists on complaining after that, you will bring a pulse. Do not bring a pulse from yourself. So again, number one, history. Number two, very important, when you are assessing idea about the condition. Number three, disclose smoothly. Apologize, keep apologizing as much as you can. And then in the end, offer solution. What is the solution? We need to take another sample. Sometimes he can ask you, what will you see in this sample? You will simply say that there are some deposits around the blood vessels or around the tubules in the kidney, which hinders the filtration. So one important thing here not to forget, number one, when he tells you, I cannot take it, simply ask him, yeah, I know why. He will tell you it was painful. Doctor, it was a lengthy process. Doctor, I had a long waiting list. You will now address all his concerns in a nice way. Like, for example, for the pain, we are going to give you a mild sleeping medication. For the waiting list, we will put you as a priority. What else? For the longer process, we'll make it as quick and as gentle as possible. Okay? No valid reason has been found. So when you are justifying yourself, just say that we have searched the hospital extensively, though we could not find it. Sometimes this guy is very stubborn and he is not convinced at all about what happened. So if someone is not convinced at all in the end and after, and I doubt that because it's all about your own way of convincing. If someone is not convinced, please right now, what you can do, you can refer him to have a meeting with the senior to discuss the possibility of what happened and the possibility of next biopsy. This is what you can do. Okay? Okay. When someone is reluctant to have a procedure for his own health, like for example, when someone is reluctant to undergo endoscopy or undergo any procedure which can be beneficial for their health, always stress that we are doing this for your health, to help you get better as soon as possible, and to give you the best possible treatment. And also as well to exclude other relevant conditions. So play on him by saying that we need to do this for your health. This way he will be more convincing. It's why I can say I call it like, for example, the skill of convincing. The more convincing you are, the more your ability to apply the ethics. How to be convincing? Try to make your sentences short and try to speak slowly and try to speak in a low voice tone. For example, when I'm convincing you, you are, especially, when you are, I'm sure all of you have met some people from the customer agent or some people working in public relations or publications. Those people are, how to play on the one feelings. And this is the way to pass the ethics. You're going to tell them, I'm sure you don't want this to happen to you. Or you will tell him, for example, because we need to treat you better. We need to give you the best possible treatment. This is better for your health. See, with a low voice tone, which is slow and composed sentences. Do not stammer in the middle. Make your sentence short. It's fine with me if your sentences are short. Actually, it's better if your sentences are short. Okay, Dr. Elvira, your sentences should be short. You should be very concise in your talk, and you should be composed. How can I say composed? Like short sentences, okay, but meaningful. Do not speak too much. Speak in low voice tone and try always to be slow. When you are validating yourself, or sorry, when you are validating yourself, the patient concern and justifying yourself. Okay, this is a code to any angry patient. If you do this, I'm sure you will pass. And please, never interrupt any angry patient. Okay, let's move to one more station, which is one more angry patient. I had this station in my exam actually. The next one, which we're going to discuss right now, the cannula change of the CP child. This station, the cannula change of the CP child, I got it in September, and I scored 10 in it, though I did not read it, but I did only one thing. I only did one thing in this station. I kept validating her concern, like reassuring her. This mother is really worried. She's worried and angry at the same time, which is like a strange combination, but it happens. It is the cannula change in cerebral palsy child. Child is having cerebral palsy. I will do the task right now. What is the task here? Your FY2 working in pediatrics department. The patient is like he was, I think he was 6 or 7 years old, a male patient, presented with chest infection. He was diagnosed with chest infection and he has been given antibiotics, IV antibiotics, especially IV clarithromycin. Okay, the patient actually has the patient cannula has been blocked. It has been blocked many times, and the mother has got concerned about that, and she's quite worried, and she needs to talk to you. The boy has got cerebral palsy, so he's having cerebral palsy, and the cannula is blocked, and he's having chest infection as well. Talk to the mother and address her concern. Again, you will enter the station. You will tell the mother, of course, after greeting yourself. Now you know she's an angry mother, so you can sometimes skip shaking hands. If you enter the cubicle or before you enter the cubicle, you know that the mother is very angry, you can skip shaking the hand because you know that she may turn you down. Okay, how can I help you? Doctor, please do not give my little one antibiotics. You have made his skin as a pincushion. This is too unfair to him. I'm really worried about him. This is unfair. You guys are pricking him all the time. I cannot see my little one suffering and crying like this. He's really suffering enough in his life. She may even make you cry. She's very good. So what you can do, you'll tell her, I can see really it can be worrying and it's frustrating for you. Please don't worry. We're all here to help and support you and leave the little one to get over this. I'm going to ask you a few questions if you don't mind. Okay, ask me. May I know why did he come to the hospital? Now you will take some history. Again, the reason of the admission. Number one. And how is he and what was given to him? Number two. Number three, his current state. How is he feeling right now? This is number three. Did he improve? And number four, take some medical history. Like what? How was his health recently, apart from this episode of chest infection? Doctor, he has repeated chest infections. I don't know what to do to him. Doctor, he is vulnerable. You tell her, I'm sorry. This can be really devastating. And how are you coping with that? Doctor, every time we bring him here to the hospital, doctor, and I stay for days with him. Oh my God, this is really over my nerves. And have you sought any support so far? She will tell you, no, doctor, I did not. We definitely can help you with that, and we'll sort it out for you. Please don't worry. So take some medical history. Now you ask about the recent health. You told me that in the recent history he has got some frequent chest infections. Apart from that, has he had any other medical condition? Yes, doctor, he's having cerebral palsy, and he has been treated from it since he was a child, he was a baby. And how has this affected his life? She can tell you anything. She can tell you that he cannot move. She can tell you that he cannot socialize, anything. And how are you coping? You asked her about how is she coping with that. Okay? If you did not ask about how is she coping with that, now ask how are you coping with that? She will tell you the same thing. We bring him to the hospital frequently. He has frequent chest infections and he takes antibiotics for them. Okay, now we finished with the history. Move to the birth questions. What is the birth? The birth, number one, how was his birth? Is he up to date with the jabs? Are you happy with the red book? Okay, Dr. Elvira, no problem. Are you happy with his red book? Uh, Tell me about his diet, please. Any problem with the wee or the poo? Usually this guy is very clear, only he's having repeated chest infections and cerebral palsy. Thank you for bearing with me and listening to me. Now, can you tell me why you don't want him to receive the antibiotics? Doctor, because every time you give him the antibiotic, the cannula becomes blocked. So she does not want you to give the antibiotics, IV antibiotics, because the cannula every time becomes blocked. Now, what you have to conclude right now? You have to conclude that she is reluctant to the cannula and to the IV antibiotics. Let's speak about the antibiotics first. You will tell her, do you know why he should? Again, the carrot and stick approach. Number one, explain the importance of this. Number two, explain the benefits of this. Number three, explain the implications of not doing this. For example, I'm going to tell her, do you know why we should give him IV antibiotics or antibiotic as drip in his blood vessel? She will tell you, why, doctor? You will tell her that his infection is severe and it needs to be treated by IV antibiotics. Otherwise, it can cause some complications. Which complications, doctor? So now we explain the importance. The importance are similar to the benefits here. The benefits are to prevent to give him further or fast treatment or fast recovery, and to prevent further complications. Now she asks you which complications, doctor. Now you will tell her the complications of ear of chest infection in vulnerable patients are number one, lung abscess, collection of fluid in the lung. Number two, septicemia, the progression or the spread of the infection in the blood. Number three, um, actually pleurisy, which is infection in the pleura. Okay, so spread to the blood, spread to the pleura, and more importantly, lung abscess. Doctor, but he can only take the pill, not necessarily the IV. You will tell her that this condition is severe and the IV antibiotics work faster. That's very important. And as well, he is not able to tolerate the pills all the time. This guy is having, or this boy is having cerebral palsy. So tolerating the pills is not accessible all the time. One important thing to add, you will also tell her that the cannula is not only for the antibiotics, it's for other medications as well. What can you do for the cannula, doctor? What you can do, number one, try to be as gentle and as quick as possible. Try to numb the area before passing the cannula. What else you can do, doctor? If I fail my first attempt, I will go for second attempt. And if I fail my second attempt, ultimately I will call my senior. It's typically like when you are giving the patient or the combined station of the cannula. You explain it the same way. Okay, what else you can do, doctor, apart from being gentle and quick as possible and not being agent? Because every time you do this, okay, we can try smaller size cannula. What else? You can also try to, because it becomes blocked frequently, you can try to flush it every time, after each medication and every now and then. And ultimately, you can make him comfortable while passing the cannula by placing his arm below the heart. When you place the arm below the level of the heart, this is usually more comfortable to any patient. Doctor, is there any alternative to the cannula? You will say about the intraosseous infusion. Intraosseous means that it can be passed through the bone. Usually it is an emergency. In the case of emergency, an alternative to the cannula, but the cannula is more proper, of course, and more suitable. She will tell you, okay, doctor, it seems that the cannula is more important or more appropriate. What can I do to prevent the further chest infections? Preventing further chest infections can be done through number one, giving jabs. Which jabs? Like flu jab, pneumococcal vaccine, and meningococcal vaccine. And he will advise anyone in the house who is smoking or having flu to stay away from him. Is this fine? Yes, it's fine. This station is quite easy, but just I will send you right now some note for it. I will send it to you here in the Zoom group. Okay? Oops, I cannot access it. Wait guys. I'm going to send it to you right now, this approach to the Kenya station. What did you miss, Dr. Safa? To prevent the further chest infection, to prevent to prevent the previous or to prevent the frequent chest infection simply, what you can do, the oral antibiotics, you missed too much, Dr. Safa. Okay, so after the oral antibiotics, what you can do, your efforts to make the cannula less painful process. Okay, no problem. Your effort to make the cannula less painful process, what to do? Number one, you can try to be as quick and as gentle as possible and replace numbing gel. What else? Try small size cannula. What else? You can also flush the cannula from one time to another to prevent further blockage. What else as well? Try to make him more comfortable by placing the arm below the level of the heart. No, it's here concern is actually about the inserting of the cannula. So to insert the cannula, you can use a small size cannula as well to him. By the way, his veins are too fragile. So small size cannula as well can be appropriate. I mean, it is an ultimate option. Okay, so in the end, you can tell her about the intraosseous if she asks you if there's any alternative to the cannula, but you do not offer the intraosseous from your own. Okay, what is the intraosseous? It is an infusion or it is like injection in the bone, but usually the cannula is more appropriate. How to prevent chest infections from happening to him frequently? Simply giving him jabs is number one, and number two as well, you will advise everyone who is smoking or is having flu around him to stay away from him. Okay, okay. This station is very easy and short, um, but the thing is that actually uh, not everyone knows about it. I know that not everyone is having a script for this station, and that's why I'm going to share a note with you. It's on my computer, on my laptop here, and that's why I cannot share it right now. But I'm trying to do that. The problem is that I cannot minimize the Zoom, and I cannot send or post anything here. So it's better if I post it on the WhatsApp group. I will post it on the WhatsApp group. Okay, I can post it on the WhatsApp group or okay, on the WhatsApp group better. I will post it. But just remind me after the session. Okay, okay. Give me 1 minute, guys. Hello, guys. I'm sorry for the interruption. So, um, now let's move to one other station. This kind of station, I think, it was very easy. The only thing to remember is how to make the cannula less painful. In the next station, we have to be a little bit faster, like yesterday. Um, which stations we are going to perform right now? Let's start with. Um, by the way, in the end of the day, we'll do the medicine stations. Now we will resume the ethics stations. Which station are going to perform right now? One of the easy stations as well. The cannula change for Mrs. Rivers, the angry patient. Again, one angry patient. What will what is the problem here with Mrs. Rivers? Again, the approach to any angry patient is number one, listen, be a very good listener. Number two, always validate their concern. Number two, apologize whenever possible. Number four, offer solution. Number five, if the offer instant form. But if the patient insists on complaining, offer pulse. So simply this Mrs. Rivers, and I'm sure all of you know about this station. Mrs. Rivers simply she was admitted in the ward, and the problem is that her cannula was blocked, and it was supposed to be uh, changed half an hour ago. No one has answered her call, and when Dr. Wilson has noticed her, she told her that she's going to change the cannula, but she went away and she never came back again. And that's why she is quite frustrated. That's why she's quite frustrated and angry patient right now. So what to do right now? Simply, you will enter the station to Mrs. Rivers. How can I help you today? I need to know why didn't you today change my cannula? Again, I'm here to address all your concerns. Tell me what happened. She will tell you the full story. Like I answered or I buzzed the button and no one has answered me at all. You would ask her, for example, has anyone came to talk to you? She will tell yes, your colleague, Dr. Wilson. She came to change it, but she never showed up again. I need to know why she did this to me. Okay, when anyone asks you anything you do not know about, please, please always say, I definitely talk to her and find out what happened and come back to you. By the way, also one more thing. The task here says that Dr. Wilson was busy with some other duties. She was seeing some other emergency patients. Okay? So Dr. Wilson was seeing or was checking other emergency patients. Do not remember this. Okay? Okay. So right now, you will tell her that I definitely talked to her to find out what happened and definitely come back to us. Come back to you, sorry. Okay. So doctor, when she insists on why did this happen, you always tell her the same thing. I don't know what happened, but definitely I'll come back to you. I'll talk to her to find out what happened and come back to you. And if possible, and I can let her come and explain herself to you as well. Yes, you can let your colleague come and explain themselves. She will tell you, I do not want to see her face. Again, apologize and validate her concern. Just simply say that we are all here to help you and support you. And I'm going to change your cannula right now. So number one, you apologize to her. Number two, change the cannula right now. Offer healer solution right now. Like we said, number one, apologize. Number two, change the cannula right now. By the way, this patient will unlikely resume the conversation with you till you change the cannula. So apologize and then directly change the cannula. For example, by the second or the second minute of the station, you should be changing the cannula. At least you will say, I'm going to change your cannula right now. The examiner will tell you a student doctor. So I changed your cannula right now. Um, she will say, thank you, doctor, but I need to know why did she do this to me. You will keep apologizing again. And if possible, you will tell her, having said that, today was a busy day and she was seeing some emergency patients. But this is not an excuse usually, or this is not an excuse actually. We are all here working as a medical team, and she should have sought help from other members as well. Is it really my mistake, or is it mine? She will ask you the same thing, and you will keep up. This station is always about apologizing. But here's the core or the different thing is that she may ask you that she needs the dose of the antibiotic right now because she needs to be discharged. For example, this cannula block has delayed her antibiotic dose, and this delay in the antibiotic dose will delay her discharge. She needs to be discharged as soon as possible. Why? Because, for example, she's having some work to do. You will tell her definitely, I can talk to my senior and will consider giving you the antibiotic dosage straight away. Having said that, don't worry. The delay in the treatment will not affect, or the delay in the antibiotic will not affect your condition. Here, reassure her. You will tell her that, okay, you're right, but the delay will not affect your health. We have sorted it out for you, and this delay is not supposed to harm you. But I have work to do. I have to do work. We can provide her with medical certificate, sick note. If anyone is concerned about the work, you can provide them with a sick note. Okay? Okay. What else? If she still is unhappy, you can offer her instant form. And in the end, if she is still unhappy, you can offer pulse. So again, number one, apologize. Number two, change the cannula as soon as possible or as fast as possible. Number three, apologize again and try to justify Dr. Wilson. However, stress that she should have sought help from someone else. However, I need to talk to her to find out what happened, and I will definitely come back to you because you do not know what Dr. Wilson was doing. So please, whenever you know nothing, always say, I definitely have to talk to her to find out what happened. I will come back to you. Reassure her that the delay in the treatment or the delay in the antibiotic will not affect the treatment. Also, you can provide her some sick note if she asks about the work. And if she insists on pulse or on instant form or in, like she asks you, does it happen a lot in your hospital? You will offer instant form and in the end, pulse. Do not bring pulse on your own. Let her ask about pulse. Next station is practice station. We will practice it. It's quite similar to the past one, but you will talk to Dr. Wilson herself. Who wants to practice with me? It's a very easy station. I need someone to practice with me right now.
Can I again?
Let someone else take the chance right now.
I can.
Okay. Who wants to practice right now?
I can, brother.
Dr. Masih, okay. Open your camera. You know the task? The task says that before opening your FY2. I will tell you the task. Your FY2 working in GP. No, your FY2 working in E&E. You are going to talk to Dr. Wilson. Dr. Wilson is your FY2 colleague, but she has just started her rotation in the department. She was supposed to change the cannula to Mrs. Rivers, but there was a delay in the cannula change for which Mrs. Rivers has been absolutely angry.
Okay.
So Mrs. Rivers is angry because of that. Dr. Wilson has been seeing some emergency cases in the other room, and now she has been told that you need to talk to her. Talk to Dr. Wilson, discuss the matter with her, and address her concern. Special note, none. Okay? Let me open the camera and the timer as well. Wait. Let's start. Wait.
Yeah.
Start.
Hello.
Hello.
Hello. How are you?
Wait. Before starting, I need to give you one tip. Can you see me clearly, or the video is frozen?
Video is stuck.
Frozen, right?
Yeah.
Okay. Why don't you tell me? Anyway. Okay, Masi. Okay, I will tell you. Okay, can you see me right now?
Yeah.
Okay. One thing is that this Dr. Wilson is having poor eye contact. She's looking in the ground because she knows that you're going to bring a matter for her. Okay?
Okay.
Okay. So if I'm looking like this doesn't mean that I'm ignoring you. I'm just looking like this because I'm ashamed or embarrassed or something. Okay?
Okay.
Okay, let me set the timer for you.
Hmm.
Wait.
Hello.
Hello.
If I am not wrong, you are Dr. Wilson. Am I right?
Yeah.
Yeah. I'm Dr. Masi, one of the senior doctors here in the department. Nice to meet you.
Thank you, Dr.
How are you feeling at the moment?
I'm fine. I'm fine. Today was fine.
Yeah. And how's everything going on?
Everything's fine, but just today is like sort of tiring day. I've been working all day long alone. My colleague has been absent today, so I have to see all my patients alone today. And it's really hectic day. I can't imagine, today is Monday. Today is the start of the week, and we have many duties to do. And I'm working all alone. Can you imagine? This is too much for me.
I know this must be very hard, but did you speak to your consultant regarding this issue?
No, actually, I did not speak. Actually, I did not even have any time to speak.
Okay. So how are you coping with that? Like everything on your own?
Yes, doctor, just today. But apart from today, everything was fine. Doctor, why did you need to talk to me? Because I have been told that you need to talk to me, and actually, I do not expect something good. Because I know that you are sort of like a serious doctor, and you are always shouting, and you are always frowning in the word round. So I get to know that you are the sort of, no, I'm sorry to tell you, but your talks are not usually nice. So tell me, why did you want to talk to me? I'm really worried.
All right. So I'm here to talk to you about one of your patients. If I'm not wrong, you have been seeing a patient which goes by the name Mrs. River.
Oh,
Am I
yes,
right?
yes, yes, Miss Rivers, yes. Yeah.
Yeah. So
What about
I
her?
just saw her. Yeah, I just saw her, and she told me that you're supposed to change her cannula.
Oh, yes, I was supposed to change her, but I had some
Yeah.
other emergency. What a day.
Okay. Could you please explain me the reasons why didn't you change her cannula?
Doctor, simply, doctor, I was having another emergency. I told you I'm working all alone today. So I was in the next room. I was having a patient who's having heart attack, and I was taking him to the chest X-ray room or the X-ray room, and all of a sudden he had cardiac arrest. I didn't know what to do. I followed with him, and I kept supervising his care and his treatment and support, and I called our seniors as well. And I got really involved. I could not go back to Mrs. Rivers. I forgot about it. I totally forgot. I'm really sorry for
Okay.
that. I'm going to change your channel right now.
Firstly, it's really great that you know how to distinguish the priorities. But did you ask someone else to change the cannula?
No, not really. I was involved. I could not even have time to think about it.
Okay. I'm not here to blame you or to criticize you, but in such events, don't you think it is really important to ask your seniors or colleagues for help?
Yes, doctor, it's important actually. You're right. I should have I should have done this at least or considered this at least.
Okay, all right. But could you please tell me what are you going to do now? Because she's really angry at the moment, Mrs.
Really?
River.
Is she?
Yeah, yeah.
So what can I do? It's the first time I meet an angry patient really. No one has ever been angry with me. I'm a very good doctor. I'm very
Yeah,
competent.
I can see that. I can appreciate that you're concerned at the moment. So I would say it would be better if you can confront her and talk to her and explain why you did what you did, and hopefully she'll understand why you are not able to change the cannula, and just apologize to her and explain your situation and circumstances. Hopefully she will understand.
Doctor, but what if she does not accept? What can I do?
Well, if she's not convincing or if she is not able to understand what you did, Then do you know about the incident form?
Instant form against me.
Well, because in the hospital we are here to give the best possible care to our patients, and if she feels that her care has been compromised, we need to tell her about the further steps that needs to be taken.
Are
And
we going to
incident form
fill?
is,
Are we going to fill an instant form against me?
well, if she insists on filling an incident form, then we might have to fill that form, unfortunately.
Oh my God! What a terrible day.
Well, please don't be worried about that. But at the moment, it's really important that you go and speak to Mrs. River about this issue and explain your actions, why you did what you did, and hopefully she will understand your circumstances.
Okay, doctor. Okay,
Okay. And lastly, I would have to speak regarding this issue to our seniors
doctor.
because it's
Senior, doctor. It seems that I'm going to be fired today. I never expected to be fired in the beginning of my rotation. Doctor, I saved the patient to cardiac arrest. Can't you imagine? And now you are firing me. You're making complaints and like you're kicking me out. Really, is it fair?
Dr. Wilson, please trust me, it's not something personal, but this is really important to bring this issue into into the, I would say, it's important to tell the consultant about this issue because as you said that you're the only one who are working in the department and you are managing all this patients and everything on your own. So it's really important to tell the consultant about the shortage or about the unavailability of your colleagues. So it's really paramount that we bring this issue to your consultant.
So, doctor, what will they do to me?
Sorry.
What will they do to me?
Well, firstly, they will understand the situation, why you did what you did, and you need to explain your circumstances to them. And then they will bring this issue up in the board meeting, and hopefully we can resolve this issue soon. But at the
Okay,
moment, it is really important that you go and speak to Mr. River and change the cannula.
okay, okay,
And please, in future, if you feel that you need any help or any support, please do not hesitate to ask us. Please, we are here to work as a team, and we will be always there for you. Please do not hesitate.
okay,
All
okay,
right?
okay.
Okay. So what are you gonna do now? Could you please tell me?
Doctor, I just hope that after all this, he does not want to complain.
Okay.
Because, doctor, what if she wants to complain, by the way?
Well, if she wants to campaign, then you can tell her about an independent service which is in the reception area where she can lodge a complaint, and that independent service will like take this issue into detail and see what they can do.
Okay, okay, doctor.
Right?
Thank you. Thank you,
Okay.
doctor. I'll consider this. Thank you really for your advice. I really appreciate that.
All right. And please do not hesitate to ask for any help.
Thank you. Close the camera.
Hmm?
Close the camera. No, your performance was really good. Seriously. Your performance was
What?
really good. Your performance was very good in this station. Seriously. You were very good and very understanding and very assuring to her. But the thing is that you were stuck at one point. The instant form, Dr. Masih, the instant form, the aim of the instant form is to improve the quality. You have to reassure her by saying this in the beginning, and after that, you explain to her that it will be discussed between our seniors and they will reach the best possible option to cover any shortage or any shortcoming in the hospital.
Uh,
So reassure her that the aim of instant form is not to harm her. The aim of that is to only improve the hospital services.
mhm.
One thing as well, you encouraged her that she prioritized the emergency. That was perfect. One important thing I forgot to tell you that you yourself had, one important thing that you yourself had to change the cannula for Miss Rivers. This was written in the task, but anyway, I forgot to tell you, but it's not a big deal. You encouraged her to
Okay.
change the cannula. No problem. Um, This is the station. Can you imagine this station? It can come to you and you can finish it in less than 5 minutes and you can score 10 or 11 in it, or even 12. Welcome back, Dr. Elvira. Okay, so when you are dealing with your colleague, number one, build a good rapport with him or her. You built a very good rapport by asking how are you today, how is your work or how is your job doing today, how is your day, do you have any patients waiting for you? You have to ask this question. Do you have any patients waiting for you? Okay. It will be going. It will go. It will be, or it's going to be like a quick chat, and hopefully, we will be done soon because you need to see other patients. Because sometimes you can tell your doctor, please, I need to see other patients as well, so try to be quick. Okay. Now you will tell her that we bring the matter. So, do you know about Mrs. Rivers? Oh, yes, doctor. Now her face will change. She will look a little bit worried. Yes, doctor. What's wrong with her? You were supposed to charge her a few minutes ago, if I'm not mistaken, right? So you think, yes, doctor. Yeah, I know why. If you charge her, sorry, you were supposed to give her change her cannula a few minutes ago. Yes, doctor. I was supposed to do that. Have you changed her cannula? No, doctor. I didn't do. Yeah, I know why. She will tell you the full story. Encourage her that she prioritize the emergency. It's very important to encourage that. However, don't you think that we should have informed one of us? Because we are all here to help and support each other as well, besides support our patient. Yes, doctor, that's right. So I'm going to change her can right now, doctor. Well, actually, I changed it for her, but I just need you to do one thing. I just also need you to go and explain yourself to her. Notice that she is very angry right now at the moment. Oh, really, doctor, is she? Now you will tell her, I'm afraid she is. And that's why I'm going to tell you some few tips how to tackle this issue. To deal with any angry patient, Dr. Wilson, you have to listen to her very carefully. Never interrupt her. And number two, try to be very assuring and show her some apology from time to time if possible. And then justify yourself or give her the reasons. For example, tell her that you are seeing many emergency cases. Maybe she will understand that. Do your best to make her happy. However, if she insists on complaining, you will tell her about pulse. When the patient insists on complaining, say about pulse. So do you know what we else should do, Dr. Wilson? What, doctor? The incident form. She is worried about the incident form because she does not know about the incident form. So explain to her about the incident form, that is the report to the hospital authority to improve the quality of services provided by us to the hospital, to the patient, sorry. Okay. If any patient asks you, can I see the incident form? You will tell the patient. Okay. If any patient asks you about, can I check the incident form? You will tell them that the incident form actually is confidential. Okay. Okay. This is the whole station. And in the end, you can encourage her and offer her some help and support, and always ask her to respect the teamwork and seek help from the other people or the other team members. Very easy and straightforward station. The next station is very similar to it. Dr. Gupta. Dr. Gupta was supposed to discharge a patient, but he was overwhelmed with other emergency cases as well, so he could not discharge the patient. So now talk to Dr. Gupta and bring the matter to him. Like Dr. Wilson, exactly. Very similar station, but they changed it from discharge card, from blocked Kenya to discharge card. Discharge means that discharge of the patient. He was supposed to discharge here the patient, and he was late. This is very similar to it. Okay? Okay. But the only difference is that in this Kenya station, you changed the Kenya. But in the discharge card, Dr. Gupta was the one supposed to do the discharge card, so he's going to do the discharge card right now to the patient. I mean, here the Kenya was changed by you, but in the other station, the discharge card has not been changed yet, has not been issued yet. So Dr. Gupta is going to write it to her and go and talk to her, to the patient, and apologize to her and the same story. Very similar station and very quite easy and straightforward as well. Let's move to one of my favorite stations actually, changing the counselor. What about changing the counselor station? This girl is having depression. She has been treated by depression for the past 6 months. She took sertraline for a while and counseling sessions. She stopped sertraline because her doctor told her that sertraline is enough. Now she does not need any more sertraline, but she will continue with the counseling sessions only. And the counseling sessions have been helping her too much. She has got some concern. Special note, none. So, who wants to practice with me? I need someone to practice with me.
I can.
Masi, spare me a little. You will practice with me personally, by the way, after this session today. And I will tell you
All
which
right.
station to practice. And guess what? I will tell you which station, and
Uh-huh.
still I will pick many mistakes from you in it.
Okay, all right.
This is a challenge, okay? I will practice with you today after the session. Wait, let me pick up one station for you. Very easy station, Masi. I'll practice with you the, what? One of the insomnia cases. I will practice
All
with
right.
you the insomnia of lost husband.
Insomnia of the.
Lost husband. The one who lost her husband.
All right.
Or no. I will practice with you the domestic violence with insomnia.
Okay.
Okay, but next. Okay, so who? Dr. Elvira. Dr. Elvira, step up. Dr. Elvira. It is changing the counselor. The lady or the girl who wants to change the counselor into female counselor.
Hello?
Hello.
Hi. Is it about I'm in love with my counselor, is it?
Yeah, exactly. I am the. Oh yes, you are in love. No. I am the one who's in love with my counselor, not you,
Yes, yeah.
because
Yeah,
I'm your
yeah,
patient.
she is. Yes.
Okay.
Um okay. So I will do it, yeah.
Yeah, you will do
So
it. So that's
I
why.
am a doctor.
Yeah, you are the doctor definitely. I'm not here so that I can practice with you. You're the one who will
Okay.
practice right now. Okay. Okay.
Okay then, okay. Okay, let's do it. Yeah.
Okay. Just wait. Let me turn the timer. Turn on the camera, Dr. Rivera, and I will turn my camera.
1 second. I'm thinking how to do it. 1 second.
Okay. No problem.
Here. Here.
Yeah, I can see you right
Hi.
now. Hi. Wait. I will open the
Hi.
camera. Wait. I'm opening my timer for you. So.
Hi everyone.
Hi everyone. Okay, start. Wait. I'm just
Hello.
turning on the video. Wait. I was not turning the video. This is from your time. Okay. So, wait. Start.
Hello. This is my badge. May I proceed?
Proceed.
Hello. Is it Miss Jane?
Yes, doctor. I am.
Nice to meet you. My name is Dr. Lomax. I'm one of the doctors in this department. How can I help you today, Jane?
Doctor, I want to change my counselor.
Oh, I see. Let us think what we can do about it. I understood what you want, that you wanted to change a counselor. May I ask you a question? Why you want to do that?
Doctor, simply it's my right. I want to change my counselor. I want a female counselor.
Of course, it is your right. Of course, it is your right to choose the counselor you want to do a counseling session with. But the only reason I just wanted to find out why you wanted to do that, and if you don't mind.
Your eye contact. Do not lose the eye contact.
If you don't mind, do you mind if I'll ask just a few questions?
Okay, ask me.
Would you please tell me why did you have to take counseling sessions?
Oh, yes, I have been diagnosed with depression since 6 months.
Oh, sorry to hear that.
Since 1 year.
Sorry to hear that.
Since 1 year.
1 year. And you've been having these sessions ever since?
Yeah, doctor. I have been taking the sessions together with sertraline. But
With
my
sertraline?
yeah, but the doctor told me that I should stop sertraline because I'm getting better.
Good. I'm glad that you're getting better.
Yeah.
How did you find it? Were they very helpful, the sessions?
Perfect.
Were they overall?
They were perfect.
Did they help you?
Yeah.
I'm very glad. Seems that the counselor has done a very good job.
Yeah, doctor, it's very enjoying and they were interesting counseling sessions actually.
I'm glad that you enjoyed them. Do you mind me asking why? What was the reason for depression?
I had a breakup, doctor.
I'm sorry to hear that. Sorry to hear that. You went to the GP and he prescribed you first medications, and after you were sent to the.
Yes.
Okay. Okay. Thank you. Just a few more questions about your general health. You've been taking sertraline for quite a while, and you're still taking it.
Yes, true.
Do you take any other medications apart of sertraline?
Doctor, I stopped sertraline. Doctor,
you stopped.
yes.
I'm very sorry. Yeah,
But I do not take any medications also, doctor.
Okay, good, good. Do I ask a medical history?
I don't know.
Oh. Jane, let us talk about what do we talk about? About the
psychiatry history. Okay, I'm just telling you.
Oh yes, yeah. You said that generally it helped you. The sessions helped you overall.
Yeah.
And how would you say your mood now been?
My mood is absolutely fine, doctor. My mood is improving actually. You know,
very good.
I used to be feeling very low, but right now I'm feeling very good.
I'm glad that you're getting better. How about sleep, appetite?
They are improving actually. They are improving too much.
Wonderful, wonderful. Who do you live with?
Doctor, do not lose the eye contact anymore.
Okay. Sorry.
Okay. So
that was my problem. That was my problem in the exams now. Sorry.
doctor, actually, I'm living alone right now. I'm living alone right now.
You are living alone. So these sessions were probably very important for you, as far as.
They were. So...
Would you please tell me a bit more about these sessions and about the counselor and the actual reason why you wanted to change him?
Doctor, please, I just want to change him. It was very good. It was very good experience, but I just want to change him, please.
Of course, we can arrange that. If we can arrange that, it's your right to choose what counselor you choose. But I just wanted to find out the underlying cause for that. Maybe there was something, I don't know. For good. I used to practice this station for good, totally.
Shh. Calm down. Calm down. You are a doctor, okay? You are a doctor. You are not supposed to stammer, okay? You are very good. You are excellent, and I will help you now. Just calm down.
Okay, thank you.
You do not need to remember anything. I will tell you right now something. I am stopping the timer right now. I'm just going to tell you one point, Dr. Rivera. When a patient is not opening up in PLAB 2, sympathy, empathy, and reassurance. Again, when someone is not opening up at all in PLAB 2, sympathy, empathy, and reassurance.
Okay.
How to do that? Please don't worry, dear. We are all here to help you and support you. If you want to share anything with me or with us, please do let us know. Feel free to share anything with us.
Okay.
Calm down.
Let's go.
We will continue that.
Okay.
Go.
Jane, we are here to support you. If there is anything which is concerning you, please feel free to share with us. And I'm sure I'll assure you that.
Wait. You did a good job. Cut down. Now you did a good job.
And I had to stop.
Yeah. You did a good job. Please share with us. Doctor, I just want to change him.
May I know what was the reason? What is the reason behind? whatever you say in this room will be confidential within our medical team. Jane.
Doctor, actually, I was involved with him.
I see. I see. Was it consensual?
Yeah.
And
Fine, you're going very good. Ask what's next, what's next, what happened next?
okay. What happened next?
Doctor, you know, we used to meet too much. And at some points we were physically involved.
I see. I see. Was it consensual? Consensual,
Yeah,
or
yeah.
he?
Yeah, no, he didn't force me in anything. I did this with my own will. But you know, yesterday I saw him in the mall, and I saw that he was walking with a girl. So he came to me and he told me that she is his girlfriend, and we are not supposed to meet anymore because he will be cheating to her if he meets me. So please, that's why I want to change him.
Oh, I do understand now where you're coming from, and it must have been very, very painful.
Yeah, it's fine, doctor. He helped me too much. I just want to change him right now.
You know, when he actually told you that he shouldn't be involved with you, he was right. The reason why I'm telling you that the patient, we shouldn't get involved in any sort of relationship with our patients.
Why?
So therefore, because it is against our morals, it's unethical. So therefore,
it's fine, doctor. It's fine. I just want to change him. I don't want any troubles. Keep going. Keep going. You still have time. No, you still have time. You still have half a minute.
Okay, yeah. Of course, we will change your counselor. There is no doubt about it. And if you would like to, I can arrange for you a female counselor.
Okay, please.
That would be possible to arrange. But at the same time, Jane, what I just wanted to tell you that we have to. I'll have to inform my seniors about
Why, doctor? I don't want any troubles, please, doctor. Please, no troubles, doctor.
I see that you're concerned about him, and I see why during this year he helped you a lot, as you said, to get out of your depression. But unfortunately, as explained earlier, it is it's unethical. Or when we start working,
Doctor, you mean that it could affect other people as well, right?
Yes.
Okay. So, okay. So what are you going to do right now? What are we going to do?
Well, first of all, we will arrange you another counselor.
Okay.
And after we'll have to escalate this to
our
the seniors.
What will the senior do?
Most probably he'll be reviewing his misconduct.
Yeah.
And they will decide what to do later on.
Thank you, Dr. Rivera. Dr. Rivera, actually, you are really good, but you lose temper very quickly.
Yeah.
You lose temper very quickly. No, it's fine. It's fine. It's absolutely fine. I will tell you right now what to do.
Okay.
Do not sleep early today. Okay? Do not sleep early today because you'll be having to talk to me after this session, after Dr. Masih. Yes, okay? After Dr. Masih, he will be talking to me. Okay?
Okay, yeah.
Okay. Close the camera right now.
Okay. Right now.
Yeah.
What is it? Yeah.
Yes, exactly. Thank you so much for volunteering for this help, for this station. Actually, this is challenging. This is either easy or challenging. I just need to take a few minutes break before giving the feedback and before everything. If anyone wants to take a break, you go do anything. We'll be back in ultimately 10 minutes. Okay.
Okay.
Dr. Elvira, you have to stay. Don't go anywhere.
No, I'm here. No,
Okay.
I'm here. Yeah.
Okay. So see you in 10 minutes.
So guys, we just did the counseling session, no? Nothing apart from that.
I think this was the ethical one where the lady, she loves it.
Yeah, it was an ethical one.
Yeah. And what was
But the
before? I
thing
missed.
before this one, I think it was that Mrs. River or Gupta one.
Okay. Okay. They changed. Cannula wasn't changed on time. Yeah.
In the Gupta one, it was that delay in the discharge.
Okay. Okay. Mhm.
Yeah. All right.
Okay.
And did Dr. Ahmed give the recordings for the yesterday session?
No.
Okay. Then we need to ask him.
I'll probably have to. Yeah. Dr. Moons, Funza, are you there? No, one is there. Islam, where is Islam? Islam? No. Islam, yeah. Mm. Oh my God, my charger go down. Big problem, I talk too much.
When is your exam, Dr. Avila?
Oh, exam is yeah. Someone is me. 23rd of May. I was actually not too bad at counseling session. I just haven't practiced, which is literally haven't done it at all. I was so put off with this feeling. I'll start practicing
That's
again. I'll have
okay.
to.
Everything comes with practice, I would say.
Of course, yeah.
Yeah, but apart from this, we need to know the script. What is in the script?
Sorry, what
That is
did you
also
say?
key. It's important to know what is in the script.
In the script, I sort of remembered, and I forgot what was the. I remember she loved him, and he sort of cheated on her, and she was upset. Found a pretty patient.
The thing is, once we enter the cubicle, we forget.
Exactly, exactly.
Yeah.
And you know, because all this they are so different, and sometimes the simulators, they look at you like with a really ratty look, kind of.
They're professional, no?
I'm not sure. People say it's very important to be liked by simulator. I don't think that I was liked much.
When you've been
Sometimes
assigned a task,
sometimes I clearly felt that they weren't happy with me. But in some station, I felt the simulators, they really wanted to help. Some of them probably like me, but I did pass few stations.
I failed those sessions where I was certain that I'm going to pass those sessions, but I failed those sessions miserably. Trust me.
Oh yeah. Mm.
Yeah. And I passed those sessions where I wasn't certain that I'm going to pass.
Mystery, isn't it? Like IELTS speaking or IELTS writing.
No, in IELTS writing, you need to be sure what you're writing.
Speaking as well is very subjective.
Yeah, it depends on the examiner also.
Yeah, very much. So.
What's their level of speaking? What's their level of writing? Anyway, so your exam is in Manchester or in Cambridge or London?
Manchester.
Okay.
In London,
Does
there are
anyone
people say that there aren't many examination stations. Is that true?
where in Manchester?
In London.
I think it's a new center, probably that's why, but I'm not sure.
And where do you take exam? London?
Manchester.
Okay. Oh, lucky
Yeah,
we.
but I heard one thing that on Wednesday and Thursday, these are the 2 days where usually we might have a sim man or examination on
Well,
Wednesday and Thursday.
thank you very much.
Yeah,
I have it on Wednesday.
yeah.
And my
Because,
first attempt was on Thursday. You're
okay, and you got
right.
the sim man or examination?
Of course.
Yeah. This is some calculations. So that's why
Really?
I didn't book the 30th May exam.
Oh. Okay, so you booked Monday.
It's, I think, Friday.
Oh, clever you.
No,
Okay. Hello, brother.
No, Dr. Masi, no, this was not true for me. I also took on Wednesday. I didn't get any SIM.
No, but the thing is, Dr. Subra, this is the calculation which is made by my friends. That mostly they are calculating the
You know what?
exams which we did in the past.
The hallway, all the Siemens were there, and Inspire guided us that if you see Siemens in the hallway, you must be getting Siemens. But all of my any cases were on real patients, hypoglycemia, AE, pulmonary embolism. All of them are on real patients.
All right.
No,
And let's pray. Let's pray. This time we will have a better exam and hopefully a simpler one.
Yeah.
Hello.
Hey people, hello
Hello.
everyone.
I think now people are speaking up.
Otherwise, it was only you and me. Messi, is that you, Messi?
Yeah, I'm Messi.
My name is Elvira.
Wait, Elvira, nice to meet you.
Nice to meet you. Where is Islam? We decided to practice his exam exactly the same day like mine. Yasmin, are you coming to Academy? Are you coming to London at all? Yasmin? Where's
Is anyone
Yasmin?
here from Aspire?
Of course.
You're from Aspire.
Yes.
And which batch you were in?
I was in the most unfortunate one, Pi.
Batch 5, like which started from
Pi.
Yeah, that 5, whatever it is. So it started from February 8 or 9?
No, I did the course back in October.
Oh, okay. So you are the only one from Aspire. No one else.
I think Dr. Sugra is from Aspire as well.
Okay. And apart from Mehdi, bro, is anyone taking the exam on May 31st?
I don't know. My oh, Dr. Sugra probably she's sometimes on 30th or 31st. I don't remember clearly.
Yeah, I think our exam's on 38.
Hello, Missy.
Yeah, brother.
Hello, Missy. Today I was sorry. I'm sorry because
No, that's okay.
my mobile was completely off, and
Uh-huh.
I was in the doctor's chamber, and you know the India very well. I have to
Yeah.
wait in a long queue for a long time.
Did you
Okay.
get the converter for your iPhone or not?
Yes, I have got the
Okay,
computer.
okay.
I have bought this.
Okay.
That's why I'm talking with you. Otherwise, it won't be possible. Well, okay. May I know your compilation? Is there any date outside Manchester?
I couldn't hear you, brother. Could you please pardon?
Okay. Is there any other exam location outside Manchester on the same day?
It's London and Cambridge. That's it.
Oh, London and Cambridge.
Yeah.
Center has test in 31st May.
On 31st May, I think the only place which was available was Manchester.
Manchester. So what is your calculation that we won't have any Siemens?
The thing is, mostly people have told me that on Thursday and Wednesday, there is a chance, high probability that you might get a sim man or exam.
No. This is not the ultimate. This is not the ultimate solution. You know? If there is another test in Cambridge or London at the same day of Manchester, there is no Siemens. 100%, 1000% sure. But if your test is in Manchester and no test outside Manchester, I'm I'm very much what should I say?
Sure.
I'm very much no, not sure. I'm very much
Positive.
okay. It's difficult to find out the adjective. Okay, you are in trouble, man, because there is Siemens.
But sim man is fine. We just need to practice. We just need to practice that what we have to do if we face a certain situation. But if we get more number of examination, no, then there is a high possibility of passing those examinations.
No, because in examination stations, the passing number will be less. So don't worry.
We will be fine, brother. We still have a month to go. We can practice. That's it.
Yes.
We need to practice our weakness. We need to work on that.
Where you go? Are you going to Swami's, Missy? Sorry, I interrupted.
No, I'm going to Aspire. But the thing is, I will be going to the London on the last week, like a week prior to my exam.
Oh, okay.
Yeah.
So we will meet up there.
Yeah, sure. Why not?
Yeah,
But your exam is on 23rd, no?
Ah, yes. Oh, I'm gonna miss
Okay.
you.
Me too.
That's it.
Anyway, let's just practice and let's just hope that we do well. Because I hope that all the people who are here, they are the second timer, not the first one. Or
I
is there
think the
any?
most of us. No, there is young man. His name is Islam. He's doing first time. He has exam exactly the same day like me.
Okay, all right. Yeah, because the day when I took my exam, 70 or 80% of the people who were taking the exam on that day, they were repeaters.
When did you have? How many people passed from your batch? From my batch, the passing rate was, I don't know. 40%?
I don't know the passing. I don't know the passing percentage. But on my day, the exam.
Yesterday, one of my friend was sharing this information that these May dates, they are exceptionally created for retakers. So it would be really tough. It would be really tough because these dates were not there before on the GMC side. All of a sudden, how come these was dates came into
No, it's a game played by the GMC because when people were checking the website a week or 2 weeks before, they were not having these dates, which the dates we got. Yeah.
I kept asking by any doctors, like on different forums, and none of them would acknowledge. Once the result came up, 4:30 morning.
Yeah. So this time we have a higher chance of passing this exam. because there will be repeaters, and you will be one of them.
Should be difficult.
Yeah, inshallah, we'll practice
Ah,
much better.
it means that if there are more repeaters, then the passing rate is higher.
Yeah, obviously, because once the repeater, he will know much more than the fresh one, I would say, because he knows the script. He knows how to deliver the script.
When did you have
So,
exam? In February?
my exam was on March 20. Yeah, March 20.
Oh, just recently.
Yeah, yeah, yeah.
Okay. Mine was 15th Jan. And those stations, they just came the first time. Those night terror, something else. I don't remember.
Now, what we have to do is we just have to practice everything. Whatever we can
Yes.
get hands on. We
That's
have
it,
no
yeah.
excuse. We need to prepare it. That's it.
I mean, as you're absolutely right. As much as you practice, it's better you get. But I remember by the time I got to the exam, I was pretty good. But today, just rough, forgot everything. But as much
Yeah.
as you practice, you get better with everything
Yeah.
in life.
And I wanted to ask one more question. Does it really make a difference if you practice with multiple people? Like, does it really?
You know, my practice partner we were from the same class. She practiced only with me, and she just easily passed it.
Okay.
And when we were practicing, I mean, in a many sessions, especially this counseling and the ethical sessions, I was quite good. But she passed it, and she passed 14 or 15 sessions. Also, she had exam in London. That was the first exams coming.
Let's hope for the best. Where are you, Ahmed, bro?
Did you?
I'm back, guys. Hello.
Hello?
Hello, Dr. Rivera.
I'm still here.
Yeah. Okay, so first of all, as someone just mentioned, your interpersonal skills are quite good, really. I like it. I like the way you open, and I like the way you open the station, and I like the way you cooperate and reassure the patient. And no, you are not sorry for poor performance. Actually, it is not a poor performance. It is actually, you're stressing yourself out for no reason. Why? I will tell you why. I will tell you simply, Dr. Elvira, this station is only about reassurance and sympathy and empathy. So why do you freak yourself out for questions which you should be asked? Like, how can I say? They are not that crucial to be asked. When you got stuck in the middle of the social history, the famish, what is the problem? You can simply ask her, and how is your life? Very simple question. How is your life? Do you have a family?
Exactly.
How is your relationship with them? Dr. Elvira, you are a doctor. You are not supposed to get stuck. You are not a candidate. I know that maybe it has been long since you talked to patients, real patients. But by the way, most of the people are having the same problem. So do not be discouraged by this. What I need you to do, I need you to be more natural. Okay, now you throw the scripts away because I see that you have been repeating the same sentence more than once. You have been saying, what should I do now? What should I say right now? I practiced it before. I practiced it before. Why do you bother about the station? And you're having the solution and the real way out before your eyes right now. I will tell you the approach to this station, and please, I need everyone right now to not follow certain set of questions. I need you only to know how to approach this station, particularly in any ethical station. And please listen to this carefully, Dr. Elvira, because this twist can change. Okay? Dr. Elmira is from the common stations, but Dr. Elvira is our colleague right now. Okay? Okay, so one thing here is that you can mute yourself right now, Dr. Elvira, if you wish.
Okay.
I will tell you everything. So the thing is that, Dr. Elvira, when you enter this situation and someone is having any concern, always ask why. She will tell you, doctor, I just want to change my counsel. I want a female counsel. Definitely, it's you right. But just before that, is there any particular reason for that? No, doctor, it's my right. Okay, that's fine. Can I ask you a few questions if you don't mind? Now we will start asking. Here's a question. When you ask questions, Dr. Elvira, you always ask, number one, why did you have this? Because of depression. Oh, I'm sorry for that. Must be quite tough experience. Yeah, you know, why did you have depression in the first place? You asked about everything. You asked like what I'm asking. Why did you have depression? And how has this affected your life? Tell me about your appetite. Listen, when someone is having any concern or any medical problem he is presented with, you ask about the symptoms of the relevant condition. How to ask about symptoms? Now in the depression, you ask about the sleep. You asked about the appetite. Very good. And you could also ask about the weight problem, if you ever have time. Just two symptoms from the depression are quite enough. Two symptoms from the depression are quite enough. Dr. Nigar, can you listen to me right now? Can you hear me? Okay, so now you'll ask about symptoms, some symptoms of the. Okay, no problem, Dr. Mary. Some symptoms actually are very enough, but the more important thing is to explore your social life. You know why, Dr. Elvira? Because when someone is having depression, I need to see how their condition have went or have gone. We need to see how their condition has progressed so far. So I need to ask her, how is her relationship with the family? Does she have any other friends or not? And is she financially stable or not? Very simple. Famish. Always remember depression, famish. Depression, famish. And then you scored her mood very well. So simply here you will elaborate, ask about symptoms of depression, and you will elaborate social history, which is the famish. After that, you will tell her that I could see that you are quite improving. Don't you think it's a little bit strange that you want to change the counselor after that? She will tell you, doctor, I just want to change her. And now she will be concerned and a little bit worried. She doesn't want to open up. Dr. Elvira, if anyone in PLAB 2 is not intending to open up to you, please, and you know that there are some concerns behind them, please always offer reassurance and sympathy and empathy. Reassurance and sympathy. I need you today, tonight, before sleeping. Try repeating the reassurance 10 times before sleep and 10 times when you wake up in the morning on empty stomach. Do it even before taking your breakfast. Repeat the reassurance and sympathy and empathy as much as you can. This is the key to passing this stage. Your interpersonal besides some data gathering will pass you this station. Okay? Okay. And I believe that your interpersons are quite good, but you freak yourself out for no reason. Why do you freak yourself out? What is the problem if you forget to take some social history? Just ask her, how is your life? What is the problem if you ask her, if you forget to ask about depression symptoms? Just ask her, is your depression improving? Example of sympathy and empathy here, I can't see or I can't imagine that it could be a tough time to you. But please don't worry, we are all here to help and support you today. I'm sure that you had quite a lot in the past few days. But I'm sure also if you share anything with us, we'll be in a better position to address your concerns and support you even more. This must be quite hard, I'm sure. But the good thing is that you came to us today, and we will definitely sort it out for you. See, sympathy and empathy, if you are going to rely on the sentences, you will not manage it. Sympathy and empathy is exactly like what Dr. Elvira did. Yes, we are here, all here for you, to treat you. Dr. Rivera did it efficiently. She was playing with the face, facial expressions beside some good sentences. If you are not feeling what you say, please do not say it. For example, if you are going to tell the patient, I'm so sorry to hear that. Tell me, no, don't do this. You just say, I'm so sorry to hear that. Just show that you are really influenced by what you say. One important thing Dr. Rivera used to do here in this station, you went blank many times. Why do you go blank, Dr. Rivera, when you are already very good? I mean, your strength and your your PowerPoint is that you are actually, you are very good in terms of communication skills. So if you go blank, this means that you threw your communication skills away. What I need you to do, always smile to the patient. You will be practicing with me many times after the course and even sometimes during the course. Mind that when I see that some person is having or freaking themselves out for no reason, I am sorry to tell you, and I'm sorry to wait. I'm stopping the recording right now. Why I do have bad experience with domestic violence because I was very scripted in the first attempt actually, but this time actually I wish I could have got the domestic violence. Why? Because I knew what is the core of the station. In the domestic violence station, Dr. Elvira, and please concentrate in that. I enter the station and ask her, by the way, the task says that you are FY2, working in A&E. The patient has been presented with an episode of vaginal bleeding. The patient is 8 weeks pregnant as far as 12 weeks pregnant as far as I remember. And your nurse colleague has examined her. Sorry, the ultrasound has been done and it showed viable fetus. Also, your nurse colleague has examined her and there was no bleeding. And the nurse colleague has noticed some finger bruises on her forearm or her wrist. Talk to the patient, address her concern. Talk to the patient, address her concern. When you enter the cubicle, you'll find a lady, not a lady, she is like 20 something years old, wearing black and giving you poor eye contact. And even she is sitting by her side, like she's not facing you. She is sitting by her side. Why she's sitting by her side? She's wearing half sleeves. She's wearing half sleeves and sitting by her side definitely to show you the bruises on the forearm. Because I'm sorry, if you are blind, you will notice that. So that she gives you no excuse to overlook the bruises. Okay? Okay. So right now we have to enter the station. I'm Dr. XX, one of the junior doctors here. How can I help you? Doctor, I'm really worried about my little one. I'm really worried about my baby. Doctor, is he fine? Is he fine? Please, doctor, tell me, doctor. You will reassure her that we have done ultrasound scan and shows that your baby is viable or everything is fine. Oh, thank you, doctor. You relieved me. So tell me what happened, please. So the first thing you reassure her. Number two, can we go through what happened, please? She will tell you I had an episode of bleeding. How to elaborate the bleeding, guys? Again, when was that? And how much? What was the color of the blood and any blood clots on it? She will tell you it was just spotting, doctor. Okay, that's pretty fine. Now you elaborated the blood. Ask her, have you injured yourself? Do you have any blood disorder? No. Thank you. Now this is step two. So now step two, you assured her. Sorry, step two that you took history from her about the blood. Number one, reassurance about the baby. Number two, elaborate the vaginal bleeding. Number three, you will tell her that my nurse colleague has examined you and she found no bleeding. She will tell you, yes, doctor, it was just spotting, doctor. It's not a big deal. Okay, okay. One thing that I forgot to mention, you can also take some history from the pregnancy. Like, for example, she told you that I'm worried about my baby, you will reassure her about the baby, number one. Number two, you will ask some pregnancy questions. Like what? Can you confirm the age of your pregnancy? How was your pregnancy so far? Any complications? So, reassurance. Number two, some of the pregnancy questions. Confirm age. How was your pregnancy? Any complications? Number three, elaborate the bleeding. Number four, ask some medical history about any medical condition or any blood disorder. Number 5, very important. Tell her that the nurse found no bleeding. She will lose the eye contact and she will tell you, oh, doctor, it was just spotting, doctor, come on, it was just spotting. Okay. Actually, also my nurse colleague has noticed something else. She has noticed that there are some finger bruises in your forearm. Now she will try to hide them. Doctor, it's just, I banged against the door. Tell her, please, can I have a look at it right now? Or may I have a look? Doctor, okay. She will show it to you. When you see it, you will tell her that, don't you think that it looks like, it doesn't look like a door bang? It looks like it was done by someone, I'm afraid. She will tell you, um, no, doctor, it was just a bang against the door. Dr. Elvira, now you examine the bruises and you did everything you can. Yet, she does not want to open up. What will you do, Dr. Elvira? Dr. Elvira, sympathy and empathy. Very important. Sympathy and empathy are very important. Or reassurance. You can also tell her, please share whatever you have in your mind, share with us. She will tell you, Doctor, actually, I fought with my boyfriend. This is very important. Now she told you that it was done by her partner or her boyfriend. Ask her, when was that? What is the reason for that? Two important questions not to miss. Number one, was he under the effect of alcohol or any drug? Number two, how many times did he do this? Or you'll ask her, has he ever done this before or not? Then, now you elaborated the incident itself. Now ask something we call hard questions. I will post to you an approach to the domestic violence cases and to the insomnia cases. So now I will post for you today the cannula case. This is number one. Number two, domestic violence. Number three, insomnia cases. Okay, now I elaborated the incident. Ask here some questions we call HARK questions. What's HARK? H stands for humiliation. Does your husband make you feel bad? A, afraid. Are you afraid of your husband or of your partner? R, rape. Does he force himself on you? And K is that kick. Has he ever injured you before? If you didn't ask about it. So again, after elaborating the incident, ask hard questions. After that, you will know this is called risk assessment because this is essential to know if she's at high risk for repeating this or not. You know, when someone is having domestic violence, sometimes they tend to have depression. So what we can do, we can take a little bit of psychiatric history. How is your mood recently? May I know, do you have any family? Ask about friends as well. Ask about finances. So beside the heart, we need to ask some social history that vanish. Beside the mood, because she is having domestic violence, so definitely her mood would be low, right? After that, actually, you will get to know that this girl or this lady is at high risk of the recurrence. Why at high risk? Because actually she is, number one, she's unemployed. Number two, she's living alone. She's having no family, no support. Number three, she is having a little daughter. So this girl or this lady is at high risk of recurrence. So you will tell her, I'm sorry for what happened to you. Really, this shouldn't have happened. But don't you think it's a bit unsafe to stay with your boyfriend? She will tell you, doctor, but what can I do? Now you can offer her the treatment or the management. We can help you with that. We can refer you to a person designated for domestic violence in the hospital. So you will refer her to a person. This person will talk to her, and this person will refer her to an organization called Marak. Marak, I'm writing its name. Okay, wait. So you are going to refer her to a patient, to a person. Okay, a designated person for domestic violence. This person will arrange for her a meeting with an organization called, or will coordinate with an organization called Marak. So this patient is definitely the representative of Marak in the hospital. What is Marak? It's an organization which deals with the cases of domestic violence, and it provides number one, safety plan to the people who are at risk of domestic violence. Number two, they provide housing. Number three, they provide financial support. So safety plan, housing, and financial support, and they can as well contact with the police in case if she's really unsafe. But now she's worried. Sometimes she can tell you, doctor, but he can follow me. You will tell her that your safety will be ensured by this organization. Doctor, how can I fund myself? You will tell her that you will be provided housing and accommodation as well. Doctor, but I do not want to leave him. You will tell her that it's quite unsafe for you. Moreover, now you are not only alone, you are pregnant, which means that it's risky for your life and for the unborn baby yet. Okay, doctor. Thank you, doctor, so much. I will consider that. So now you will refer here to an organization, to a person who is representative of Marak, and this person will set a safety plan or will coordinate with Marak itself. What is Marak? Organization which coordinates with police and social services and provides safety planning and housing and fund to the people who are under the risk of domestic violence. Okay? Okay. This station is domestic violence, and why I had bad experience with it? Because I was too scripted. The girl was telling me, doctor, I'm really worried. She has been giving me some non-verbal cues that she's worried and poor eye contact. In PLAB 2, let's have a stop here. In PLAB 2, you have always anyone who's having poor eye contact or worried, you have to verbalize what you say. Always verbalize, I can see that you are worried. I can see that you are annoyed by something. Even if you are running out of time, say this. Because one sentence from the patient can give you the diagnosis and can give you the whole management plan. I can guide you toward the management plan. So always, please, always verbalize what you say in the face of the patient, what you see in the face of the patient. Acknowledge the patient cues, non-verbal and verbal cues. Okay? Okay. So, what if she refuses what? Well, usually, what if she refuses actually that she will contact the Marak or you will put her in contact to Marak? No, now she's at high risk. This is number one, and number two, it's not only risk for her, it's also risk for the baby. So now you will tell her that actually it's not only you. This can also put your baby at risk, and I'm sure you don't want this to happen. So in anyone who's pregnant or anyone who's having a child, always play on her and play on the fact that it can happen to the baby as well. When you mention the baby, she will be worried and she will accept. Okay, so in PLAB 2, always acknowledge. This is number one. Number two, when you move from one set of questions to the other, always signpost. How? For example, don't ask, for example, and any family member is having any medical condition. Do you smoke? Do you drink alcohol? Don't do this. After the family history, you will tell the patient, let's have a quick review about your lifestyle, or let's review your lifestyle, or let's talk about your lifestyle. Do you smoke? But don't tell the patient, may I talk about your lifestyle? Don't take permission from the patient. Just say, let's talk about your lifestyle. Do you smoke? Do you drink alcohol? So always signpost before each set of questions or each pattern. Okay? Okay. When you move from the presenting complaint to the associating symptoms, for example, the patient presented with chest pain and you elaborated it and we are done with it. When you need to ask about associating symptoms, do you have anything else? Like what? Okay, when someone is presented with chest pain, there are some questions that we ask. Like what, doctor? Do you have any fever? Any cough? Like this. So always signpost before each set of questions, before associating symptoms, before lifestyle as well. And before sexual history, I'm going to ask you a few personal questions. Always signpost, and we mentioned this in the initial class, but some people are not following it. So please do that, because if I catch you in the practice and not following this, you'll be killed. No, you'll not be killed. You will pay more fees. Oh, yes, the insomnia is another scenario, Dr. Samia. We'll discuss it right now. This is my next station right now. Okay, right now let's move the, yeah, in pregnancy is pretty high because she is vulnerable. You know, what happens, let's speak honestly, apart from being doctors. What happens in pregnancy? She overlooks him and she doesn't look interesting to him anymore because she's pregnant. I'm sorry. So what happens is that he loses interest and he becomes too stressed and he becomes too bothered by her. So the risk of domestic violence is very high when it comes to the pregnant ladies or pregnant girls. Okay? Okay. So let's right now let's speak about the stations that Dr. Samia has been mentioning. The insomnia. How to elaborate the insomnia? Okay, I told you that today I will send you elaboration of insomnia, elaboration of domestic violence, and elaboration of the cranial change. When someone is telling me, I'm having problem with sleeping, may I know what is the problem exactly, or can you tell me more about the problem? Doctor, I go to the bed at 10 p.m. and I hardly fall asleep at 2 a.m. What if the patient did not tell you this? You know what to ask? You have to ask the patient, what is the problem exactly? Do you find it difficult to fall asleep? Or you wake up in the middle of the night? Or do you wake up early in the morning? Because there are three patterns of insomnia, either hard to fall asleep, or wake up at the middle of the night, or wake up in the early morning. They will tell you definitely all the insomnia patients, except in one case, um, the insomnia patients usually are having troubles falling asleep. Okay, okay. What else? In this station, simply, she will tell you, doctor, I have it difficult to, I find it difficult to fall asleep. Elaborate it. For example, since when it started? How did it start? Has it changed? Has it been continuous or like any other complaint? Has it been continuous or comes and goes? Very important questions to add in the case of insomnia. Do you take any naps during the day? She would, for example, suppose that she told you yes. You will ask her how many naps and when is the last nap. Okay, now move to what do you do before going to bed? Do you drink tea or coffee or do you watch TV? Yes, but doctor, I have been doing this since very long. So now this is an old habit. Old habits never give insomnia. Okay, okay. So old habits never give insomnia. Okay, now you don't have any reason for her insomnia. Elaborated the insomnia and you don't have. Instead of asking too many questions because insomnia is quite complicated. What do you think can cut the history very short? What we spoke about in the first session. In the first session, I told you there is a magical question that you should ask in any long-standing complaint, which is unexplained. Which
Any
question?
idea why you are having this?
Perfect, Dr. Masih. Perfect. Any idea why did you develop this problem? She will tell you, doctor, I have been thinking too much before falling asleep, especially since I lost my husband. Or if it is domestic violence, doctor, I have been thinking too much before falling asleep because I have too much stress due to the fights with my husband. So there are two scenarios. One is having bereavement, and the other one is domestic violence. What about the bereavement? Let's speak about what about the domestic violence? Let's speak about it quickly because we just discussed it. She told you that she has been fighting with her husband. So ask her the same question. Since when? And how is your relationship with him? And how was it before these fights? And now ask her, I'm going to ask you a few questions. Please don't feel embarrassed. Has he ever, does he make you feel bad about yourself? Are you afraid of him? The hard questions. Does he force himself on you? Does he hit you? If she says, yes, he hits me, you will say how many times? And when was that? And was he under the effect of alcohol or recreational drugs? Okay, okay. Hark questions again. Now elaborate the famish again, and in the end you will tell her that actually your sleep problem is due to the problems or the stress you're having because of the thinking too much about your husband. Doctor, but what can I do? Now you will ask her, have you ever thought of leaving him? In the previous one, she was at high risk. That's why you advise her to leave him directly. But this girl, she is not high risk. She is not pregnant. She doesn't have anything. But you would ask her, have you ever considered leaving him? She would tell you either yes or no. If she says yes, again, Marak was the same thing. What Marak can do: safety plan, housing, accommodation, and police. And also they can provide her with a helpline, national helpline. It's like a phone service which deals with domestic violence cases. You can like call center, which you can call and tell them that I'm exposed to domestic violence. Okay. Okay. What if she tells you, doctor, I never considered this? By the way, one important thing: if she considers separating or quitting her husband, you will also tell her that, by the way, her mood is a little bit low. So you will tell her also, apart from this product thing, we can offer you some counseling sessions with one of our colleagues because it seems to me that you are feeling low. Yes, Dr. P, that will be very helpful. Okay, that's great. What if she never thought of leaving her husband? This means that you should fix the relationship together. So you offer her number one, Marat again. Number two, some counseling sessions with a colleague because of her low mood. And number three, some measures to fix this relation. How? We call them the counseling, the marital counseling sessions. The marital counseling sessions, in which the couple, you see them in the movies, the couple are going to a counselor, and this counselor discusses their marital problems or their like life problems together and try to fix them and try to sort them out for them. Okay, so in case she wishes to separate, you will Marak plus counseling sessions CBT. And if in case she does not want to separate, you will tell about Marak and CBT plus counseling sessions with a trained counselor in the marital issues. Marak will handle social services and the police. Okay? Okay. So, this station is a domestic violence. It's quite similar to the first one, but she's also having insomnia. It's a very easy station. Right, Dr. Samia? The simulator is nice, I have heard.
Just can I ask a question?
Sure.
Just regarding the insomnia, when you ask the questions about the insomnia, tell me more about the insomnia. What's the problems exactly, and elaborate more. And then you went to the magic questions, which is, do you have any idea what will be that one? What about the other structures like past medical history, like social history, family history?
We said about the social history. We said about it.
Oh yeah.
Yeah. But the medical history, you can also ask about it. But I mean, you know what will be your medical history? Your medical history will be, do you have any medical condition? Do you take any
Yeah,
medications? Any family history of any problem? I mean, the medical history, you can always take it. But in these stations, you should cut it short. It is more or less
why?
psychiatric. Why? Because it is more or less psychiatric station. By the way, domestic violence are sometimes, they are considered to be psychiatric because they are usually associated with low mood. So, I mean, your main aim here, okay, you can take concise medical history, it's fine. Like medical condition, you have take any, you should actually take medical history because you are in A&E. No, you are in GP here. So you should take a part of medical history. But let it be concise, Dr. Zaid. Like, for example, any medical condition, do you take any medications? Like this. But do not go too deep. Do not go too deep, like, for example, ask too many questions. No. Here, ask after asking the question of the idea, You know already what is the reason, right? And that's why I've been telling you always to ask this question of the idea. But one important point I have to be honest. Sometimes, sometimes, sometimes she may not tell you. She may not tell you about anything. I mean, for example, there is no reason for her insomnia. Even if you ask her about her idea, she can tell you, doctor, I think, for example, I don't know really. So when she tells you, I don't know really, you know what to do? You have to take good medical history. You will ask her, how was your health recently? At this moment, actually, she will tell you, I'm feeling pain. This happened only once, and it was in late January. She will tell you, doctor, I'm just having like body pain. Why you have this pain or any reason for this pain? Yes, doctor, because I'm having some. She can tell you that she's having rheumatoid arthritis. So the cause of her insomnia is medical condition. But usually, when you ask this idea, the patient will tell you the concern. Okay.
So
Um,
the
yeah.
insomnia case is only, so we have only one insomnia case, or because
No, we have at least four insomnia cases. One insomnia bereavement, and one insomnia domestic violence, and one insomnia, which is a infection, the pain that I told you right now, and it came only once. And the newest one is the insomnia, the one who asks for sleeping pills, and we will discuss it shortly. Okay. The insomnia, I will send you an approach to the insomnia cases after finishing. It will be concise on how to elaborate it. Um, I'm going to send you the step of the insomnia cases, okay? But I'm repeating the steps for each station for you many times so that you follow it. Yeah, I will send the approach for the insomnia and the domestic violence at least. And for the other stations, I can form it for you, but I can send it to you after the end of the course, like after the 15 days. It will barely take you 2 hours to read them. The general approach for all the stations of ethics. This is what I can do, and this is, by the way, what I was planning to do. Ethics and counseling. I can guide you to the approach. But the medicine, it's very hard because I need to write many lines of management and many things. Okay? I think this is better because if you are scripted, you will end up wasting too much time. Okay. Let's move to the next station, which is the same station actually. It's insomnia, but with bereavement. Which bereavement here? In the bereavement, actually, you will tell. She only opened up only when I asked her, was there any particular instance that led to this? Did you ask her about her idea, Dr. Samia? Do you have any idea what could be the reason? Or what do you think could happen and lead to the reason? You simply, the question of the idea can be manipulated. For example, do you think or have you had any something strange which could lead to this? Or can you think of anything which could lead to this? Do you have any idea what could be the reason for this? Because let's speak reasonably. How can you guess that this is because of the domestic violence unless she tells you? Because definitely that's why you can ask her. I mean, could you ever think of something like strange which had happened and led to this? Or anything have you started doing anything recently which has led to this? So it's different because if she does not tell you about this, it's hard to guess. Seriously. Maybe she may be giving you some nonverbal cues that she's worried about something. She's hiding something. This way you can pick it up and you can say, I can see that you are worried. May I know why? She will definitely tell you right now that she's worried because of this. Okay, let's move to the next one quickly. The next one is insomnia with bereavement. Again, when you ask her about her idea, she will tell you, doctor, I just can't stop thinking of my husband. I lost him. He passed away 6 months ago. I'm feeling lost without him. Doctor, it's really hard for me to cope. So this station is about sympathy, empathy, and reassurance. Sympathy, always please write in your notes that the insomnia cases are about sympathy, empathy, and reassurance. Sympathy, empathy, and reassurance. Especially this old lady. This old lady, she's having bereavement, which means that you should show sympathy, empathy with every sentence. Sympathy, empathy in every sentence. Please, she's old lady and she's very nice, but she can't sleep. She may yawn during the station. Like the poor guy of the obstructive sleep apnea. You know, he wasted at least 2 minutes of my time in yawning. Whenever I ask him a question, he keeps yawning. And the station is already long, and he keeps yawning. So you have to say that, I can see that you are quite tired, or you're quite sleepy. She'll tell you, yes, doctor, I really need to sleep. Okay, so she's having bereavement. What are the important questions here which she tells you about the bereavement, Dr. Zaid? Dr.
Yeah,
Zaid.
the important question is, we'll ask her, how does she is coping with her loss of her husband, the coping.
Perfect. How are you coping? And after that,
Yes.
ask about the mood.
Yeah, mood, yes.
So now,
Mood
anyone with bereavement, you have to ask about mood and famish. Please do not forget about these questions. Insomnia cases are all about psychiatric history, and domestic violence cases are about psychiatric history. So please do not forget that you need to take full psychiatric history here and some of the medical history, like for example, do you have any medical condition? Do you take any medications? Okay, and do you have any family member diagnosed with any medical condition? Like this. Okay, so please do not forget to assess the mood and the famish here. And in the end, you will tell her, it seems to me that your sleeping problem is because of you have lost your husband recently. Doctor, but what can I do, doctor? We can definitely help you with that. What is the help? She will tell you, doctor, please help me. I'm really feeling bad. I cannot sleep since long. I think it's dangerous to my health. Reassure her and tell her we are having variety of options to offer you. Which options, doctor? Number one, you will give her some advices, and you can also refer her to some counseling sessions. Why counseling sessions? Because her mood is low, or to support her. The counseling sessions is to support her after her bereavement. But don't say the bereavement. Bereavement, it means like I'm telling her it's because of your bereavement. No, just say because of your loss in a low voice. So say we are going to refer you to counseling sessions to support you and help you feel better and cope with that. Also, we can give you some advices. Which advices? You will tell her that she tries to socialize, try to involve herself in social activities, try to go to the like have some shopping from time to time, try to play some sports, even if walking is very enough. You can also advise her about the sleep environment. What's the sleep environment? Like to make sure that the place is not noisy, to make sure that the bed is comfortable, to make sure that the room is not too hot. Doctor, can't you give me sleeping pill? Me, I know why you need them. Doctor, because I need to sleep. Now you will tell her that sleeping pills are the last resort. If the general measures did not manage, we can prescribe the pills for you. So the pills are the last option because they are having some side effects as well, like dependence and tolerance and withdrawal. So this station is quite similar to the past one, but here you have to address her bereavement by giving her some lifestyle advice like to socialize, and you refer her to counseling sessions as well to cope better with what happened. Okay? Okay. Please, if anyone is leaving anytime, please tell me beforehand. Okay? If anyone is leaving, do let me know beforehand. Send me a message, tell me that you are leaving. Okay? So one more station, and it is a new station actually. This new station is the guy who wants to be prescribed sleeping pills. This guy, what's wrong with this guy? He simply is having insomnia since few months, and he wants you to prescribe sleeping pills for him. Why does he want this? I will tell you right now why. Okay, let's speak first about the task. I'm just going to pick the task. Um, your FY2 working in GP surgery, male patient, middle-aged patient. Yeah, maybe in 10 or maybe in 20 minutes ultimately, Dr. Masih. We will end in 20 minutes ultimately. Okay? Your FY2 working in GP surgery and the male patient, 25 years old, he wants to discuss his problem with you. This is the whole task. He's very aggressive. He looks aggressive and anxious. He's losing temper very easily. He will tell you that he's having difficulty falling asleep. And this problem is since ages, which means that it's long-lasting problem. Tell him, okay, we agreed before that when someone is not sleeping properly or having long-standing complaint, what will you ask them? How has this affected your life? He will tell you, doctor, I'm sleepy all the day, doctor. I don't know what to do, doctor. Okay? Okay. So, now this patient, when you finish elaborating the insomnia the same way we did before, you will ask him, do you have any idea what is the reason? He will tell you that he keeps thinking too much and he is stressed. So now I can see that one of the reasons here for this guy is that generalized anxiety disorder. He's very anxious and he's very stressed. This guy again is very anxious and very stressed. And by the way, this is the reason for his insomnia. Okay, give me 1 minute, guys. I'm sorry. Hello? So he thinks too much before sleeping, this guy. What is the reason of that? This guy is having a very short temper. He can tell you, I don't know, I just think a lot. And he's showing you that he's stressed and he's losing temper. And this guy is really, really nervous. So now you pick up that he thinks too much and he's having generalized anxiety disorder. Okay, and he's having some leg shaking, which shows that he's properly stressed. Ask him some symptoms. Since when have you been thinking like this? He will tell you since very long. Okay, okay. Since very long, and you need now to ask about some symptoms of the anxiety. Which symptoms? Like, do you feel anxious all the time? Yes. And do you have any tremors? Sometimes he says yes. Do you have any sweating? Sometimes yes. Okay, do you have any difficulty thinking? Any difficulty concentrating? Any difficulty making decisions? Do you have any heart racing? Like the symptoms of anxiety to anyone. And by the way, this guy is pure case of generalized anxiety disorder. So now you know that his insomnia is due to, it's totally opposite to the previous station. The previous station was anxiety due to, it's insomnia due to depression or low mood. But here it is insomnia due to anxiety. So what you will do, you will elaborate the famish again and the mood, okay? And after finishing the station or after coming to the management, what to tell this patient? The patient actually will tell you, doctor, will you give me the pills or not? Which pills? This guy has come here because he need to take the sleeping pills. Okay? But he cannot take the pill. Why? One thing here we should remember is that when you are asking him about any alcohol or like the lifestyle questions, when you ask him the lifestyle questions like any alcohol, he will tell you, Doctor, I'm a social drinker, but I take cannabis. So he has been taking cannabis since long. And also he has been using sleeping pills of his mother to help him sleep since long. And that's why he cannot sleep right now, because his mother took the pills from him. So he need to be prescribed the pills, right? You will tell him that I'm afraid that you're not fit to receive the pill. Why? Why? Number one, because actually in his case, the insomnia is more likely due to the anxiety. So what to do? We're going to refer him to a psychiatrist, and you're going to help him with some CBT or counseling sessions. Number two, sleeping usually can be dealt with some lifestyle changes and some advices. Number three, which is very important, the sleeping pills are the last option always for psychiatry for the insomnia. He will tell you, doctor, why last option? Because they have some side effects. Like what? Dependency, withdrawal, and tolerance. Like any substance, the DWT, dependency, withdrawal, and tolerance. This is number three. Number four, it is also harmful or dangerous to prescribe these pills for him. He is already taking cannabis, so both things can make him feel drowsy, and this will put his life under risk if he is drowsy all the time. Okay? So, if insomnia is because of the anxiety disorder, we can refer him to psychiatrist. Number two, his insomnia can be treated with some lifestyle changes. Number three, usually the medications come later. Why come later? Because they're having some side effects. And number four, it's unsafe to prescribe the medications for him beside the cannabis that he's taking. Both of them can cause him drowsiness and put his life under risk. When if he asks you why my mother was prescribed the pill, you will simply tell him that this condition differs from one person to another. So her response to the lifestyle changes would be definitely different from yours. So if she was not responding to them, we would definitely give her the pills. Okay? So one more station, the post-mortem examination. In the post-mortem examination as well, this station is quite short. You can even finish it. You can finish it in, like, how can I say, you can finish it in 4 minutes or 5 minutes. We are left with two ethical stations, by the way, the gender selection and the consultant son. And we can do as well one medicine stations, or which is rheumatoid arthritis, if someone is interested. And we can resume the remaining two stations tomorrow, the medicine. I don't have any problem doing the medicine stations, but I'm sure you will not endure it. So let's speak about the post-mortem examination. In the post-mortem examination, there is a lady, I had this station in my exam as well, in the September, the first attempt. This lady is quite, how can I say, she's quiet. And she's telling you, doctor, I need to find, you have, by the way, you have to enter the station. You do not smile in this station. She lost her husband. So enter here with like, not very serious, but just, normal look. She needs to know, she needs to find out why his husband has died, why her husband has died. Ask her, tell her first, the most important thing is to tell her that please accept my condolences again, or please accept my condolences. I'm sure you're having quite a tough time. She will tell you, yes, doctor. And how are you coping with that? Would you need any help or support? Do you have anyone else to support you and help you? Yes, doctor, but I'm just concerned about my husband. Why did he die? Now tell her that, what have you been told? She told, doctor, they told me that he died because of the chest infection. Actually, that's right. Your husband died because of one of the complications of chest infection. Do you know what is this? She says, no. He died because of respiratory failure. What is this, doctor? This is a condition in which the lungs are unable to supply the other parts of the body with oxygen. And now I guess, or I'm sure now you think why this can be fatal. Oh, yes, doctor. But I was not convinced, doctor, and I'm not convinced actually. May I know why? Doctor, I just want to find the reason. Okay. Ask her, do you have any concern in your mind? When someone is insisting on something, I told you, ask why. But still, if they are not convinced, ask them, maybe they are having some concern in their mind. Doctor, I'm not still convinced. Do you have any particular concern in your mind? If someone is not convinced, ask why. And if this person is still not convinced, ask why. If this person does not accept this, then ask them, may I know if you have any particular concern? She will tell you, doctor, my sister, she's a nurse, and she told me about the post-mortem examination. You will tell her, yes. May I know what have you heard about it? She will tell you what she heard about it. Now you have to speak about some things. Number one, the post-mortem examination, it needs to be done, okay, after her consent. So we need to take her consent because it can be done in case one of the relatives needs to find out the reason of the death of their beloved ones. So we need to take her consent. Number two, it is done in special hospitals. Okay? Okay. Doctor, how long will it take? Because I need to arrange for the funeral. Oh, okay. The process itself takes only a few hours. Sorry, the operation itself. But the whole thing may take few days, up to 2 weeks. Doctor, tell me more about this procedure. Okay. In any procedure, we divide it in any procedure in the medicine. We divide before and during and after. Even in surgery stations, when we discuss them, inshallah, in 2 days, you have always to keep this in mind, before, during, and after. Before the procedure, we examine the whole body carefully by looking at it. And then we do some scans like ultrasound and CT scan and x-rays. Okay, this is the external examination, which is before. Number two, during. Now we are doing the procedure itself. We open the body in Y-shaped line or Y-shaped incision or collar incision. Just say we open the body carefully, okay, in a simple line incision through which we can look inside the body and we can take the relevant organ, which is, for example, the lung in his case. We take the organ and we look at it carefully. If there is any doubt, we can send it to the laboratory to be examined under microscopy and take sample from it. Oh, doctor, so we remove it, and that's why we need your consent. Because we need your consent for the procedure to be done. Number two, in case we need to remove some organs to send them for further examination. And what's next, doctor? Will the body be disfigured? You will tell her definitely that the reconstitution of the body is very important. That's why we are going to close the body in simple stitches. And it will be also covered in a casket. Casket, which means that there will be nothing observed. What about the organs? Here there is some mistakes, guys. Please notice this. The organs will be back to the body before the burial. Before burying the body, you will have to put the organs back in the body. You have to handle here the body in full form. Only in one case you can keep the organs in the laboratory for longer. I mean, usually you put the organs and then stitch the body. Only in one case you can keep the organs in the laboratory, which is the case of scientific research. And in this case, you're going to ask her consent one more time. So again, we usually, after examining them, we put the organs back in the body and then stitch the body back and then arrange for the funeral. So the whole process may take like up to 2 weeks, but the funeral needs to be arranged within this week. So She will tell you, okay, doctor, I will think about it. Why? Because the procedure may take some time in case we need to send an organ to the laboratory. And she needs to arrange the funeral as soon as possible. So she will tell you, doctor, I just need to think about it again. Okay, that's fine. Can you please give us a final decision within 24 hours, please? Because we may need to arrange it. Okay, doctor. Doctor, by the way, can I get the death certificate? You will say, yes, you definitely can get the death certificate. Because the task tell you that the death certificate can be issued. This is depending on the task. This is the station, and when you end in the station, you can offer her some support. We are all here to help you and support you. Would you like any help? Would you like any help to cope with this situation? Do you have anyone else to help you with that? And how is your life? Okay, this is enough. It's quite easy station, but usually the people fail it for two reasons. Number one, they do not check the understanding. They keep explaining the whole procedure for 2 minutes without pausing. Till here, we divide to before and during and after. Let's start with before. We do external examination, which we look at the body carefully. Are you following me? So after each 2 sentences or 3 sentences, always make pause and let her speak. Okay? Okay. This is a post-mortem examination station. Let's move to one of the interesting stations as well, the consultant son. The consultant son, the one who needs to know about his mother condition by force. He is very stubborn. He needs to know about his mother condition no matter what's going on. Okay, what will we do in this station? You will enter the cubicle, you will find someone jumping on you. Seriously, he's jumping. I'm Dr. XX, I'm one of the senior consultant. You know how it works? It will work exactly like this. Hello, doctor. I'm Dr. XX. I'm the senior consultant here in the nearby hospital. I need to know about my mother condition, please. You know, because today is Monday and I'm very busy. I've got a very busy schedule and I don't have many patients waiting for me and I don't want to waste much time. You know, I'm a senior consultant in the NHS since 30 years and I can manage and treat my mother accordingly. I'm very good in that. I have been doing this all the time and I'm sure you know about me and you heard about me everywhere. So please tell me about my mother condition because I only have 3 minutes right now to leave. And many patients are waiting for me and I would be very grateful if you discuss this with me, please, right now. He will keep speaking at least for 3 minutes in the beginning of the station. And you do not, by the way, you can be standing because he will be standing. So imagine you will be standing for the first 3 minutes in the station. And he will pretend that he's going to leave the cubicle. He is very busy and he's very rushing. So what you can do here in this case, you know what to do? You know, if you smile, actually, this means that you are not genuine. You have to take him seriously. Dr. Islam in Egypt, if your consultant is talking to you this way, can you ever smile? I think not in Egypt only. I think everywhere. Can you ever smile if your consultant is like this? You know that consultant when he just passes by, just when he enters the department, your face will blush automatically. You will find yourself blushing. Wow, Dr. Zaid, mashallah. So the thing is that what will happen? This guy speaks too much. Do not interrupt him. Do not interrupt him at all. Let him speak and express himself like he wishes. And in the end, you will tell him, it's my pleasure to receive you today, sir, or mister, or doctor, whatever, call him whatever. It's my pleasure to receive you here today. I'm Dr. XX, one of the junior doctors here. Nice to meet you, doctor. Doctor, I just need to know about my mother condition. He will keep talking and talking and talking again. Listen to him again. And you will start, please write in your notes that 2 things not to miss in this station. When you are answering him, always say, I'm really happy to receive you today, or it's my pleasure to receive you today, or it has been a great honor to receive you today. And always validate, always like praise him. Number 1. And number 2, stress on the confidentiality or the confidential nature of his mother condition. Because you will tell him, it's my pleasure to receive you today. However, I'm afraid I'm not in a position to tell you about your medical condition till she gives us the consent to do. Now his face will change and he will tell you, doctor, are you kidding me? Just tell me. He will keep pressing on you again. I'm really sorry. I wish I could have told you, but I'm not in a position to say this. Because I'm sure you know better than me. And always use this sentence in this station. I'm sure you know better than me. I'm sure you agree with me more than anyone else. That confidentiality is one of the most important things. Like it is the center of the trust with our patients. Unless they will never trust us when it comes to the treatment and the management. Doctor, okay, doctor, I'm a senior consultant and I know this. I have been doing this in 30 years. I do appreciate your position and your profession, of course. It's my due, it's my knowledge, it's my pleasure to receive you today and talk to someone like you, really. And I'm sure I'm learning from you. But the thing is that we are medical professionals. We are bound to this rule, and we can never disclose this, no matter what happens. Okay, so he will stay silent for a few seconds. You see the chance. How to see the chance? By asking him, may I know how much do you know about her condition? She is admitted in a care home, by the way. Ask him, and how is she coping? Does she have any medical condition? What was her complaint? She was admitted because she was losing weight, doctor. And since when has she been losing weight? Does she have anything else apart from the weight loss? Any loss of appetite? He doesn't know anything about her, by the way, because she's admitted in the care home, but you need to take history. Why? To gain some marks in data gathering. Very good. If he said to you once, stop giving lecture about confidentiality to me, please, you know what to say? I'm really sorry if I gave you this impression. I'm sure that you know better than me about this. But the thing is that actually I'm just not in a position to tell you about this. That's why, Dr. Masih, you have to always start your answer by saying, I'm sure you know better than me in this. I'm sure you know better than me in this. If he gets any rude to you, like stop giving me lecture about the confidentiality or stop telling me the things that we do to our patients, tell him I can imagine it must be frustrating really, but I'm sure also you agree with me at the same time that it's part of our duty toward our patient. Okay, so he will, after you have to take some history for him to gain marks in data gathering, otherwise he will never let you. So whenever he calms down, take some history. Okay, now move to the next portion. He will tell you, doctor, I'm here next of kin, by the way. You can tell me anything. We usually tell the next of kin in one case, if the patient is lacking mental capacity. And usually we ask our patient, like, if she's able to, we check her understanding and her ability to make decisions and retain information. And if we are happy with that, definitely, we can tell her about her condition. And after checking that and disclosing or telling her about her condition, we can definitely ask her. And if she's happy, we are going definitely to inform you. I mean, if she is happy that we tell you, we're going to inform you. Again, he will stress on you that you should disclose, you should disclose. You will tell him again, confidentiality, confidentiality, and confidentiality. Very good thing, Dr. Masih, to say is that when I was practicing it with my friends, he was giving me a very tough time. Actually, he was acting like even more worse than the consultant. So what he told me, you think I don't know about these things? You think I don't know about these things? You will simply tell him that I'm sure you know better than me, but don't you think that if we compromise this or if we cross this, don't you think that our patient, especially your mother, will never come to trust us anymore? What if she feels that her symptoms are disclosed or her condition without her consent? She also has the right to make her own decisions. Don't flip anything against him. Do not turn it into debate. Don't tell the consultant that I'm sure if you were in my place, you would do the same. No, you would say it in a better way. I'm sure you know better than me that all us are medical professionals are bound to the same thing. Like this. It applies to us all. Guys, do not turn anything into debates. Like, don't say about yourself personally, and don't say about himself personally. Your point is good, but I'm not sure if it worked because he's already angry. He's very angry. You know, he can say that, oh, doctor, I don't mind. I would not do this. So what will be your reaction? Your reaction will be you'll be in trouble. That's why comes a strong thing which I'm going to tell you right now. The examiner will stop you after 6 minutes and he will tell you, doctor, what's your next step? Number one, I will document this conversation. Number two, I will inform the senior, my senior. Number three, we will go together, me and my senior, and assess the patient's mental capacity. And if she is able to understand and retain and make decisions, we're going to inform her about her condition. And after assessing her mental capacity, we're going to ask her if she is able or if she is happy that we inform her son or not. If she is happy, we will ask her how much does she want him to know, and we will definitely tell him. So number one, you will document the conversation. Why, Dr. Masih? Because this was a conversation with a relative, and not ordinary relative. He is a senior consultant, and this senior consultant is about to breach. He focuses or he forces you to break the confidentiality. That's why you are going to document this conversation, because for medical legal issue to save yourself. Okay. Last station for the ethics, the gender selection. One of the most nonsense stations. Seriously, I don't find any reason for them to bring this station unless they just want you to speak about the pre-implantation genetic diagnosis only, because there have been some issues in UK about the pre-implantation genetic diagnosis. But the academics made a big fuss of this script. Okay, gender selection simply. She needs a baby boy. They need a baby boy. So ask her, may I know what is the reason? Whatever. They need a baby boy because the husband wants a boy to carry his name. Okay. Ask her how much children, do you have any children? She has 3 daughters. Okay. She will insist, doctor, can you help me with that? Can you help me with that? Okay, you will tell her, I'm afraid it's not legal in UK to choose the gender of your baby. Doctor, but I have heard that some things can help with that. You know what have you heard? She will tell you, doctors, that I have heard sometimes that having sex at some times can help having a baby boy. You will tell her that there are some speculations. You know, usually the speculation are based that having sex near the ovulation time, will increase the chance of having a baby boy. And so sex near the ovulation time or sex when the basal body temperature rises increase the chance of having baby boy. There are some these are speculations which are not scientifically proven. Doctor, having sex in some positions can increase the chance of baby boy. You will tell her that there are also some speculations which claim that having sex in a standing position can increase the chance of having baby boy. This is not confirmed, or this is not scientifically proven at all. And why this claim? Because it has believed that actually this is very awkward, but it's believed that the sperm, there are 2 types of sperm, X sperm and Y sperm. The Y sperm is faster. Okay, so in the standing position, the Y sperm is more likely to reach the ova faster, and that's why the chance of having baby boy is fast. Okay, so okay, thank you, Dr. Rivera, for these notes. Okay, so I don't know really, Dr. Masih. I'm not the one who has like issued these claims. I didn't try it before. Anyway, okay. So here, she'll ask you, here comes the important questions. Is there any way to choose the gender of baby in UK? The only legal way is the pre-implantation genetic diagnosis, and it's not offered everywhere. It is only offered in some private sector, and you have to pay for it. Doctor, can by any chance I know the gender of my baby after pregnancy? Definitely she can know about him starting from the second trimester. Starting from second trimester from 18, when she's having the first ultrasonography between 18 to 21 weeks. So this is the usual routine checkup in second trimester. When she was having the first ultrasonography, she will ask the sonographer to check the position and the gender of the fetus. Most of the times they can detect the gender and they can tell that to her. But there are two problems. Number one, the fetus can be in abnormal position, which do not or which will not enable the sonographer to know about the gender. And number two, some hospitals do not offer the service of telling the parents about the sex. Okay. She will ask you right now about abortion. Abortion is illegal. Abortion terminating pregnancy under 24 weeks is illegal as proven by the abortion law in UK. The abortion law states that termination of pregnancy under 24 weeks is illegal unless two doctors decide in good faith, and this good faith should be fulfilled under some medical backgrounds. What does this mean? Two doctors must decide that the abortion must be carried on due to some medical problems the mother is having. Otherwise, abortion is not legal. What are the medical reasons, doctor? Medical reasons are genetic disorders. What are these, doctor? These are disorders that can be transmitted from the parent to the children through genetic chromosomes, through the sex-linked chromosomes, which are X chromosome and Y chromosome. Doctor, okay, which means that these disorders can be transmitted from the parents to the children through sex-linked chromosomes, which means that they are more likely to affect one gender, like they can affect either boys or girls. Doctor, this is very good. We are having breast cancer running in our families. Okay, you'll tell her that this is a very good point, but breast cancer is not sex-linked disease. It is not transmitted through the sex-linked chromosomes. Sex-linked chromosomes are X and Y chromosomes, and they transmit other diseases. Breast cancer is not one of them. Okay, thank you for today. She will tell you, okay, thank you. Now your station can be over in less than 5 minutes. What you can do, take some history from here. How is your health recently? Do you have any medical condition? Do you take any medications? Ask her about the previous pregnancies. How were the previous pregnancy? What was the root of the previous pregnancy? Any complications? Take some history after the end of the station. Why? To gather some marks in data gathering as well. Because actually you remember, she pushed you towards the concern. So whenever the patient pushes you towards the concern, this means that you should, in the end, take some history. Like even at least 4 or 5 questions. Okay, one last station for today. Now we are near the end line. One last station is the rheumatoid arthritis. Rheumatoid arthritis for today. And actually, I'm feeling tempted to discuss as well the polymyalgia rheumatica, but I'm sure that the people will never let me do. Right? People will never let me discuss the polymyalgia rheumatica or the SIADA, the syndrome of inappropriate ADH. But it's fine, it's absolutely fine. We can discuss the rheumatoid arthritis right now, and for tomorrow, we can resume the next 2 ones, because tomorrow actually it's going to be less stations. We have finished, by the way, the bulk of the ethics stations, for those who are interested. Okay. So in the rheumatoid arthritis, the patient is having hand pain. Okay, and this is a task. You are FY2 in GP surgery. The patient is presented with hand pain. Okay. Now you will enter to the patient and you will tell the patient How can I help you today? The patient will tell you, doctor, I'm having this pain in my hands. I'm so sorry to hear that. By the way, one important thing. Now you know that this patient is having hand pain, right? Do not shake hands with the patient when you enter. You don't know, maybe your shaking hands can hurt him more. So please do not shake. Actually, in PLAB 2, you can shake hands with any patient. But please, not this patient. Not this patient, guys. Okay? Okay. So, how can I help you? You will tell you, doctor, I'm having this hand pain, doctor. Really, doctor, it's getting worse, and it has been there since the past few weeks, doctor. I don't know what to do. Now you reassure him, and you will tell him we are all here to help and support you. We're going to give you the best possible treatment. Please don't worry. The same thing like anyone, okay? Anyone who is worried, you will tell him the same thing. Always reassure the patient if they are worried and tell them about the treatment and this thing. Okay, now you will elaborate the hand pain as I told you. The hand pain started maybe a few weeks back, okay, and it's getting worse. Um, okay, so do you have anything? By the way, you will elaborate it like in Socrates, okay? Do you have anything else apart from that? Like what, doctor? Any redness or swelling? He will tell you, yes, doctor, actually, my hands sometimes are red and swollen. So you will ask him since when it started, how did it start, has it changed as well? Okay, ask him these questions, please. Do not overlook these questions. Okay, uh, by the way, also one more thing. In the task, I remember it was mentioned that the patient is a heavy smoker. This is not very important, but you can use it. Okay, now the patient gave you some hand pain, okay, and some redness and swelling as well. Elaborate both things. What are the associating symptoms like pain and swelling and redness? Ask about any stiffness, okay? He will give you stiffness as well. So pain in the hand and redness and swelling and stiffness. Redness and swelling, stiffness and pain. The triad of rheumatoid arthritis. What are other symptoms that you can ask? Do you have any pain elsewhere in the body? No. Any nausea, any vomiting? No. Here you can also ask about eye problem. Why eye problem? Because usually rheumatoid arthritis is associated with conjunctivitis. Yes. So your differentials are osteoarthritis, number one. Number two, trauma as well. And number three could be gout. It's unlikely, but could be. So ask him, do you have any eye problem or problem with your vision? No. Have you injured yourself? No. Okay. Ask about the past medical history. Very important here to ask about anemia in the past medical history. Why? Because it's one of the complications of rheumatoid arthritis. Why? The patient with rheumatoid arthritis will usually take analgesics or painkillers, and he will end up having peptic ulcer. Okay? Okay. You can also ask about high blood pressure. You can also ask about any kidney disease or stroke. Why? The risk of blood clots is high with the rheumatoid arthritis. So don't forget two things. Number one, the cardiovascular disorders. Number two, the anemia. Those are the most two common complications of rheumatoid arthritis. And what are the differentials here? Are the trauma, number one. Number two, the osteoarthritis. And number three, you can also ask about the recent health, like maybe any other medical condition, any fever or flu like illness recently. This is very enough. Okay, lifestyle is very important. This guy is heavy smoker. Okay. Uh, One important thing as well, you need to ask about his job. Ask about his job. Why? Because you'll ask him, how has this affected your life? He will tell you, the doctor, I cannot type anymore. He's a typist. Typist actually, rheumatoid arthritis is worsened even in typists because they are likely to use their hands even more, which will worsen their condition. Okay? Okay. Now do examination. The examiner will show you red swollen hand or red swollen fingers. What is in management? The examiner keeps quiet. What is diagnosis? Rheumatoid arthritis. What is this? Inflammation. Arthritis means inflammation of the joints, and it is very common condition. Why is this happening to me? Autoimmune. So explain the autoimmune. Okay. Okay. What are you going to do for me? Now we are going to do some blood tests for him. Which test? Routine bloods, including antibody test. Please mention the antibody test to confirm diagnosis and to exclude other autoimmune problems. So here, please mark the autoimmune or the antibody test to confirm the others and to exclude, to confirm diagnosis and exclude others as well. And we need also to do X-ray on the hand. So routine bloods and X-ray. The treatment here, number 1, analgesics, anti-inflammatory painkiller. Number 2, DMARDs, disease-modifying anti-rheumatoid drugs. Why? They will reduce the inflammation and swelling in the joints, but they take time. So it's better to start some corticosteroids beside them. In any autoimmune long-standing problem, the immediate treatment should be corticosteroids besides the painkillers because the DMARDs usually takes time. So you will start 3 things. Number 1, painkillers. Number 2, steroids. Number 3, DMARDs. All of them are together. Why I do give steroids in the beginning? Because the DMARDs usually take time to work. So the steroids actually will act temporarily till the DMARDs start working, and then we will taper the steroids gradually. We will reduce them gradually. This is the medications. Number 2, we will give him some lifestyle advice, like any joint or bone problem or any muscle problem. We'll advise to be more active, try to exercise more, try to do more swimming, some other things to help your joints stiffness to be relieved. So be active. Okay. Number 3, preventing the, so number 1, medications. Number 2, life activity. Number 3, very important, to give him some advice about the diet and smoking. Why? Because he is at high risk of cardiovascular diseases. So he needs to maintain well-balanced diet and abstain from smoking. Otherwise, he is at risk of developing blood clots. Okay? Okay. He can ask you one question. Doctor, I am a smoker. Can I take ibuprofen? This question is very weird, actually. You advise him to stop smoking. Yet he asks you, Doctor, I'm a smoker. Can I take ibuprofen? Okay. This is a silly question, and please do not mind about it too much because it's not usually asked. But if he ever asks you, you would tell him that actually the high dose of ibuprofen can increase the risk of heart disease. Why? Because ibuprofen can be containing, sometimes it can be containing sodium. It's not confirmed, but there are some theories that say so. So I wonder really how can a patient ask this question. But anyway, so if he asks you this question, the job actually is a typist. Oh yes, you mean the advice, the lifestyle. Okay, it's usually, I will tell you right now. Very good point, remind me. So you will tell him that the use of ibuprofen, the high dose of ibuprofen, can be risk sometimes for the people who are at risk of heart problem. That's why we're going to start you with a moderate or low dose of ibuprofen. However, we are also going to reassess your pain further. The job. He will definitely inform his occupational health department and inform them because he needs to take a leave because the job can worsen his condition for a while. Okay, I hope this was clear. This station is quite easy. Again, medications, activity, healthy balanced diet and stop smoking. Okay, and in the end, you will talk to the occupational health department. Okay, okay. Presentation readiness and swelling and stiffness and pain, differential diagnosis, osteoarthritis and eye problem and anemia. This is the station. Anyone needs anything? We will discuss the PMR tomorrow, the polymyalgia rheumatica. we'll be left with one. By the way, the day which we missed, the day before yesterday. Okay, Dr. Bina, the day before yesterday, I did not continue the recording, but I will send it, I hope, by tonight or tomorrow morning. I will hope so, because I will finish really exhausted, and I still need to, I need to read some things. Address his job. You will advise him to contact the occupational health department. Contact the occupational health department. Why? Because actually the occupational health department will give him proper advice, and he may need to change his job later. So this is for his health and for his well-being. The people actually who are having some problems which can prevent them from certain career or certain work, they usually are given benefits. And it's the rule of the duty of the government to afford an alternative job for them. Or discuss with the employer if the company doesn't have occupational health department, or if he's working under supervision of someone directly. Okay, so now we are done today. Now I need 2 people right now. I will just take 5 minutes break or 10 minutes break. I need 2 people, Dr. Masih and Dr. Manisha and Dr. Elvira as well. So 3 people, not 2. I need the 3 of them to meet me in 10 minutes from now. Please, you guys all will end the call, but I will call Dr. Masih and Dr. Elvira and Dr. Manisha in this conversation after 10 minutes. Anyone else can leave. I will ask Dr. Elvira to take some history from me, and I will discuss some issues with her. Dr. Masih will take some history from me. Okay, yes, we can attend Dr. Zaid, definitely. Tomorrow, by the way, you will be the first one who will practice Dr. Zaid. Okay. From now on, actually, everyone will be asked to do this for today. Yes, you can join, definitely. If you want to stay, you are more than welcome. You are coming after 10 minutes, guys. I'm coming after 10 minutes. Everyone who wants to stay can join us, but just join me in 10 minutes from now. I will ask some people to take some history from me, and other people will discuss some management plan. Dr. Masih, I need you to revise the management plan of subconjunctival hemorrhage. Dr. Elvira, yes, I'm disconnecting in 2 minutes. Or 1 minute, sorry, right now. Dr. Elvira, I need to talk to you. Maybe just need you to observe how the history taking goes, and I will need to talk to you in private even after we are done. Who else? Dr. Manisha. Dr. Manisha, I will need you to take some history from me as well. Okay, Dr. Manisha? Dr. Manisha? Okay. So see you guys in 10 minutes from now. Thank you all for listening, and I'm sorry for the elongation. It was lengthy, but I think it was better than the previous sessions. It's ethics and it's interesting. So see you all, and all of you will fix, inshallah. Good night.